an individual to be able to carry out this study. Human resource, maybe you have the skill to be able to do the study. Maybe you have some support. Does your supervisors have the necessary skill in the area that you want to conduct research? That's why when we get to study setting, you need to be detailed about your study setting, because we want to know whether your hospital, your institution can be able to have enough clients, enough patients that will be able to make you conclude this your study at the appropriate time. All that. So that is why writing proposal is a very serious work. And every aspect of it, you must be detailed about them so that the person reading the work will be able to be convinced that, oh, this work in all ramifications is good enough to pass. We are talking about proposal for colleges, for examination, for dissertation. It can also be proposal that will be applied. Now, whenever you are writing your proposal, have it at the back of your mind that the person reading you, your audience, have all these area of questions that they want to answer. Before they will tick the boxes, they will be asked all these questions. And if they now say yes, 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 yes to all these questions, then they don't have any reason not to approve your proposal. So when you are now writing, you must ensure that you try to answer all these questions so that the audience or the person reading your work at the end of the day will be able to say yes to all the sections and with that approve your work. We will still see more all these fully as we move on, but it's still nice to say a bit about it here, and when we move on, it will be revision because we want it to be as interactive as possible. So what is this study trying to address? Most of the time when people approach me that, oh, I have a study that I want to work on, when they ask the question, when they tell me the title, the first thing I will ask them is, what is the title of your study? When they tell me the title, the next important thing to me is what is the justification for this title, for this study? In other words, what are you adding? Why is it necessary for you to waste your time studying this particular research? Why is it necessary for me to review that particular research? So immediately you can justify your topic. You can tell a market woman that this and this and this is the reason, rationale behind this work. One, the reasons why it's very important for you to have it is that at some point in your research journey, there will be difficulties. There will be people that you will shake the foundation of what you've written. So it is that justification that will keep you going. That no. Even when people want to take you away from your original focus, it is that justification that will keep telling you that no, this is the aim. This is what I want to achieve. If I go the situation to move to another more in when we get to the meat of the matter. So all these are the spectrum you must cover. And you must cover them very well. And there is no shortcut about it. I like the title that the organizers gave this workshop. It's an ABC of research proposal, in the sense that virtually all research proposals have the same building block. You just need to have that framework and you apply it to your field, to your research, and everything will be fine. And that is why, as I am, whether you are I'm an obstetrician, whether you are an orthopedic surgeon, a public health physician, a respiratory medicine, whatever, if you send your proposal to me, I will still review it adequately because I know what is expected of a good research proposal. And that's all what are the key areas. And that is the essence of this program. So whatever you are taking, well, this should come at the end. So we'll say a bit of it here, and at the end, we also reiterate it again.
Hello?
Writing the proposal. There's always that inertia. There's always that inertia.
Yes, sir.
In writing proposals and all that. Okay. So, and I know about that before. Okay. So that's why I just put up this as a good way of starting off, if you want to start off at all. A good starting point for a good proposal is, I think even West African National has it now. They have it online. They have previous dissertations online. Just go for like a week. Just find time, go to the website and read previous dissertations. Read the flow, though some of them are flawed, but at least majority of them, they have the basic foundation. You read around them. From there, inspiration will come. Some of them will even tell you about, some of them will even write about limitations of their study. Some of them will recommend future research. And from those future research, they recommend that you may not say, okay, let me do that future research that's been recommended. Okay, so you can do that. And from there, inspirations come for you to have a topic. You discuss with friends that, oh, I'm thinking of this. You think about what you do most of the time in your clinics. And you also discuss with your mentors, with your supervisors to do. And from there, you can now rub minds to streamline the topic.
Sir, excuse me, sir.
Yes, please.
Sorry to interrupt. Some participants would like you to change to slideshow mode so that they can see this the slides better, if you don't mind.
Oh, they're not seeing it now. Okay.
Yes, sir. Thank you, sir.
Okay. Can you see now? Sorry, please.
Yes, it's better.
It's better. Okay, fine. All right. So, as you said, please, for the whatever topic you want to discuss, you want to work on, in whatever area, there's no area that you don't have gaps in the literature. So when you read wide, you can get gaps. And when you even read journal articles that may look unrelated to your work, you get ideas. That's why, like this Nigerian Postgraduate Medical Journal, most of the articles there in that journal, they are articles trying to solve problems from our region. And when you read those articles, ideas will come. That, oh, if somebody could write about this, then I too can write around this. For example, for those of us in obstetrics and gynecology, if somebody could talk about leptin and preeclampsia, then perhaps maybe I can talk about leptin in gestational diabetes, or I can talk about another chemical in preeclampsia. Things like that can happen. And I'm always happy to share how I got my research topic for my exam. I've been trying out, I try to look at something around pap smear. Most of my supervisors will say, oh, that area has been overflogged, that this and this. I talked about so many topics. They just said, no, don't discuss about it. We can't even go further from here. It's not researchable. Until I was reading this journal, Nigerian Journal of Clinical Practice. That's the consultant journal. And I saw in the same journal article, in the same journal, I saw 3 journal articles that were related. And what were they? They were all talking about metabolic syndrome among HIV positive patients. Somebody did a study to compare HIV naive, ART naive versus HIV ART positive patients, and was comparing metabolic syndrome in the two. In adult clinics, another one was looking at, we just take out the prevalence of metabolic syndrome among adult HIV patients. And after that, somebody now did a review article to talk about endocrine manifestation, endocrinological manifestations of HIV infection, starting from the thyroid to the pancreas to, all through like that. These 3 journal articles, they were in the same edition of the journal. And after going through them, and I asked myself, how can I relate what they are saying in adult medicine to O&G? And I remembered that in O&G, we have what we call gestational diabetes mellitus. And for gestational diabetes mellitus, we do universal screening and risk factor screening based on risk factors. And I know that HIV or being on drugs was not a reason or was not a risk factor for screening for gestational diabetes. Whereas from what I've read from adult medicine, it was almost like, I was almost sure to me that HIV positive women that are on drugs, they are likely to have some they're likely to have some metabolic disorders, in which if they not take that into pregnancy hormones can now exaggerate those symptoms. And that from there, they are supposed normally to be being an HIV patient or positive patient or being on drug should actually be a risk factor for screening for gestational diabetes. But I checked the literature, it's not there. And that was how I got the inspiration for my title. And it was from that I wrote both my West Africa title and national. My West Africa was impact of HIV and ART on glucose tolerance among HIV positive pregnant women in Lut, Lagos. And my national was to look at prevalence of dyslipidemia among HIV positive pregnant women in Lagos. And from there, I started checking the literature, reading around it. And I was surprised that some people have done some work on it, only that it was not many. So I now started reviewing what they've done for the purpose of my literature review and all that. Well, maybe when we get there, we'll we'll discuss more. So please, you can always use the chat box. So please, I may be a bit slow today. Yes, because it's interactive. The whole essence is interactive. Most of us we've attended many research proposals and all that. So the only difference in what we are doing here is that we want it to be interactive. So at some point, I will stop and I will ask for people to for questions and all that. Okay, so those are, so based on that, and I know other people will have their own experiences to share. This is my own experience, and that was how I started off. I wrote the proposals, and the proposal won grant award because it was novel in our environment, and it didn't cost me anything out of the blues, so to say, to get out the topic, all because I just read some ideas and now find a way to use that same principle that it was in a different field and apply it to my field. In adult medicine that time, what I wanted to do wasn't looking very novel. But when I now brought that idea into O&G, it became a novel topic. It became a novel topic. So those are areas you can get. So for other areas, like when you read the literature, yes, it's still allowed if it is just about the population. If somebody have done a topic in Lagos and you want to repeat the topic in Maiduguri, you have to justify the reason. Is it that Black women in Lagos are different from Black women in Maiduguri? The answer is no. But the way you can justify it may be that sometimes we need so many people confirming or validating the same thing, so that in this era of evidence-based medicine, we'll be able to pull data together to be able to help to be able to say whether based on evidence, because you can't use just one study most of the time. You can't use just one study, say if it's RCT. You can't use just one study to ground level 1 evidence. So it's still nice for you to do the same thing in another location for, okay? But if it was done among Caucasians and you want to repeat it among Negroes, yes, that something works among the Caucasian does not mean it will work among Blacks. So in the era of evidence-based medicine, so you can use that in the era of evidence-based medicine, we need to also domesticate or document what pattern or what we are getting in our environment here. So these are ideas that can keep you rolling about how to arrive at your research topic and then start writing. Yeah, these are components of good research proposal, which we'll be seeing as we move on. So let's move on. Whenever you are writing, though, as I said, these ones are best, I will still reiterate them at the end. That's next week. I still reiterate them at the end of the program. But because I just pick a proposal, a good proposal, and we start from the beginning and say, okay, from title, from preliminary pages, and we move on like that. We have what we call the preliminary pages. Preliminary pages are all what you write before introduction. They are all preliminary pages. And technically speaking, your page numbering should start from page 1. Page 1 should start from introduction. All these little things I'm talking about, that I'll be talking about, they are what now come together to make a move, to make a big issue. When from beginning, from preliminary pages, you start making such simple, scanty mistakes. The assessor will keep picking them up, and at some point, we just say, no. If you can make these errors, then who is sure that you won't have been making big errors too? Okay? So please take very serious cognizance of the preliminary pages. Don't just handle them anyhow. We produce preliminary pages last. It's always when we want to submit, and sometimes we may have deadline to submit. So it's just maybe the night of submission that we start working on the preliminary pages. Please take a good deal of time to work on your preliminary pages. One very important thing we see about error we see is that most people, their page numbering, they will start page numbering from the title page. Your page 1, that's Arabic numeral, should be from introduction. Every other thing before introduction should be Roman numeral. The title page, which is the front page, should not have any page number. Your page numbering should start from the next page after the title page. So these are simple, but they matter a lot. Okay. I may forget, but let me just say this quickly because it may not be part of what these slides here. When you've written your dissertation, your document for submission, your thesis, please be very careful as how you write your acknowledgement. What I've discovered based on my mentees and people have reviewed their work is that the first acknowledgement is an area they can write anyhow. Because I hope next week we have time for that. I will devote some time for that, for us to know that there is what we call academic writing. Academic writing is different from our usual day-to-day writing. Academic writing is sober. It has some attributes with it, which we'll talk about. I will show you examples of some statements people will write, and you will say, I'm a good English writer, I've written well. But when you write academic proposals and dissertations, we will not like such statements. So when you've trained people to write well, they will write every other part well, from introduction to methodology. They'll follow strict scientific writing. When it now comes to acknowledgement, they now start going to town, say, yes, this place nobody can catch me. Let me write it the way I like. I've seen people say, I love you, my darling husband. If not for you, if not for the way you were taking care of me at home, I won't have finished this work. Man, I thank you. They'll put man and put apostrophe. I thank you. They'll write all sorts. But please, for all of us today, that's all that is new to some of us on this platform, please take it from me that your acknowledgement page is still part of your academic writing, and it must still be structured at all. Yes, you have some leeway, but it must be structured. And how should it be structured? Even the names you mention, you must structure them. You should start from the people that have contributed most to that research work. Ladies and gentlemen, your families and friends are not the people that contributed most intellectually or otherwise to your research work. And they are not expected to be the first people you have an opening statement to say, first and foremost, I thank my wife for the emotional support, for being there for me, for cooking food for me not to be hungry. I thank my husband for doing the homework when I'm supposed to be working. No. All that they are important, but that is not, those are not the people that contributed intellectually. So the first set of people you should acknowledge are your supervisors and mentors. I acknowledge the contribution of this for doing this on the work. Don't forget that the assessor reading your work is also a supervisor. So if the examiner is reading your work, that he or she knows that your supervisor, no matter what, have had sleepless nights, have run the journey with you, and you are now just putting him or her at one corner at the end. You just know, no, this person is not yet a researcher. And you will form an opinion. And you can imagine it's a preliminary page. The person is already forming opinion about your full work, whether he should waste his time reading the whole work, or he should just pick some areas to read and award your marks. That is part of why preliminary pages are very, very important. Because the person reading your work, you want the person to feel, oh, this is a researcher. Oh, this is a good work. And you won't want to even drop the whole document before it finishes. But right from preliminary pages, if the person is already making comments, picking errors, your work may not come back on time. If it's a PhD dissertation or a master dissertation. Okay? So please note that for acknowledgement. It's your supervisors, your mentors, those people that you have contributed major chunk that should be the first line, first set of roles. After mentioning them and stating their role, my supervisor, blah, 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 then the next set of people that you should acknowledge should be other people that have played roles in this study. Is it people that help you to recruit patients? Is it funders, sponsors of the work, or institutions where you get permission to conduct the study, or other people in your team that also contributed to the study? Then from there, you can now go on to friends and colleagues. And from there, I always recommend you go down to your family. That you mention them last does not mean they are not important. Then to families and to some of us that are deeply religious, we now put to, and finally, God Almighty, who have seen me through to this stage. But if you don't want to put that, it's optional. So when you read, you see this format I'm telling you, when you are, the essence of all these things is that I want it to be 1+1. You now pick journal articles or proposals and use this benchmark to be checking. And when you are now writing your own, let it be at the back of your mind when you are writing. That's the whole essence of it. So I will stop there for the preliminary pages, but everything I've stated here, please ensure that you put them in. And as I've said, you are not the first person to do research. Pick a previous work and use it as a guide. Okay, though as I said, some previous work may also have been done shabbily. So if you use materials we'll be producing here and previous work, it will make sense to you. Okay. Now, we now want to start off again. Sorry, we keep starting. And as I always say, every aspect of this study, every aspect of your proposal is important. Never joke, never take lightly. Say, okay, this one is not important. This one is the most important. This one, every aspect, you must take it very seriously. So this page is talking about the title. Usually you may write your title like at the beginning of your work. Sometimes you may write it at the beginning, in the middle, or at the end of your work. Nobody will know. The only thing we know is that by the time you are submitting your final proposal or dissertation, that your work has a title. But my recommendation is that you should have a working or tentative title before you ever start off. You should write out something. And as you write down that topic or title, it can now start undergoing modification. The reason why I say you should have something is that it is not easy, especially for starters, to be an island when it comes to dissertation writing, proposal writing. You will need to share your thoughts with your colleagues, your supervisors, even these days with internet. You go online, you get somebody that is working on similar area, you just throw it to the person. Please, I have so title I'm working on. The reason why you should have a tentative title is because whenever you want to share your work, your inner thought about your study with anybody, the first thing that will come to the mind, the first question you are likely to be asked is, what is your title? And immediately you mention your title, the person keeps thinking within him or her that, is this thing workable? Is it, how will it happen? How will it work? How will it do? So that is why when you are starting off, have a working title that can still be changed, can still be modified. Okay? And part of the recommendation I also give to mentees and anybody that's sought my advice on writing proposal is that I always suggest people should start from simple areas. And the simple area of a proposal writing is title, objective, that's aim, specific objectives, and your methodology. You should be able to tell us, because methodology is always very structured, very, very structured. So you can just quickly write those ones, you go back again and start filling in the gap. So we will follow a particular pattern, but it's not compulsory that it must be, if you don't finish introduction, you must never go and write a methodology. No, it's your work. It's your work. Somebody complain about audio. Is it fine now? Or I'm still having problem with audio. Hello?
It's fine,
there's
sir.
a bit of it's clear for most of it, but there's a bit of interference, like I don't know, like a speaker interference somewhere.
Okay.
Yeah, that's making it a bit muffled, not muffled, but adding some interference to it.
Okay.
They're talking about.
How about now? Is it fine now?
I don't know. Are you using headphones, sir? It's like
No.
Okay, or is there something close to the speaker somewhere?
No, it was not a fan, and I switched on the fan.
I think we can manage. We do this.
Okay, so please, if you're the interactive, let's know, because that's the whole essence of what we are doing. Thank you. So you can always drop comments in the chat box. I will check from time to time. Okay. So hello. I got an echo just now, so I was wondering. But that echo may not be from me. Please ensure that everybody is muted. Let's ensure that everybody is muted. Some people may even use two, may even be using two Zoom network at the same time. Okay. So some of those can also be an issue. Thank you. So now that we are here, so please, that's it about title. And as I was saying, please note that the epidemiology of your study should come up as much as possible in your title. You want to tell us who are the study participants, should be there. Where is this study going to be conducted. How, when, and type of relationship. How and when sometimes may not be there, may not be, we may not, is not compulsory, but who, where must be there. And you must be specific. Where people run foul most of the time is where. Some people will just say, oh, I want to study impact of gestational diabetes mellitus among HIV positive patients in Lagos. In Lagos. When you say Lagos, that means your target population is Lagos. That means every pregnant HIV positive patient in Lagos have equal chance to be selected. So from that, you know that it's a major task. But if you say at Lagos University Teaching Hospital, with that, everybody knows that what you are saying is that it's only pregnant women at LUT that that will have equal chance of being selected for the study. Some people will even do what we call multi-center study, like maybe they may pick two centers, and based on that, they will say in Lagos. Some may pick maybe LUT and pick LASUT, and say because they picked LUT and LASUT more than one center, they now call it in Lagos. No. At best, you can say at 2 tertiary institutions in Lagos. You know, you have to still find a way to qualify it, because that work in Lagos, you may not be able to defend it. So it is very important for you to be specific when it comes to where. Now, the relationship, type of relationship or type of study, most of the studies that we are likely to be conducting, they are likely to be studies that are dealing with relationship between two things, between A and B, association between A and B. Like as I said, my study was relationship between what? Between HIV and drugs and gestational diabetes mellitus, or HIV and drugs and dyslipidemia. So very easy. I can just put that as my topic. Also very easy, you can turn your objective to your title. I've been telling people that if you have a SMART objective, it can become your title. And in fact, what most reviewers like is what we call fidelity of all the various aspects of your work. When I see your title and I go to your objective and I see that your objective and your title, they are speaking to one another, and your title and your objective is speaking to the specific objectives, they are speaking to your objective, that's your aim, and your hypothesis is speaking to your objective, your research question is speaking to your objective, your justification is speaking to your objective, I'll be happy. That shouldn't be redundant things. No. Everything must align from title to objective. Even your statistical analysis plan should be speaking to your title. So that's just what I want to stress there. And you know, in bracket, I put type of research there. So that what I mean by that is that these days, some journal, like the journal that I'm the associate editor, they want you to always, where it's possible, to always add the type of study design as part of your title. So if it will not make your work too long, yes, you can. Even for a proposal, you can say a cross-sectional study of the association between A and B at so. So you've inserted the research design. A case control study of this. So that's another innovative way people want you, if you can, but if it will make your title to be too long, you may just leave it out. But if you can coin it and put it in, perfect, fine. So as we said earlier, that the title should not be too long, and the recommendation is actually between 15 and 20, between 15 and 20 words. So I think we've discussed some of these things. Then your title should be catchy. The title should be catchy so that when somebody just read the title, you say, I've not heard about this thing before. Let me go and check the literature. I was attending a conference one day, though that one may not be applicable to part 2 work, but for grants awards. So what you are presenting may be simple, but they will send your grant proposal most of the time to an expert in that field that have published so many papers, done so many research on the work. If by the time your work is getting to that person's desk and the person looked at the title, wow, this is interesting, and the person have to Google, go to Google to get more information about what your research is about, then until proven otherwise, you are likely to get the grant. You are likely to get the grant. So sometimes when people say, how do I measure novelty? You measure novelty by the time you share your research title, research ideas with people in your field, and they are eager to say, wow, I never thought of this. Wow, this is interesting. And that is what somehow God helped me with my title till date. After my title went to the for ethics approval, the professor that went to my ethics, we now met at some other forum, and the person was like, wow, Gbenga, where did you get that idea from? In fact, from that day, man, my ideas about DM and HIV just changed after just from the title and reading your work. So let's just think outside the box, just sit somewhere, read materials, and you see ideas coming through. We still share more of how ideas come. So these are examples of titles that have been written. The first one says, human immunodeficiency virus infection and gestational diabetes. It's just because, as I said, for me, I don't always like, I prefer physical. Like this now, it will have been more interactive for me to start asking, okay, let's still do it. Please, can somebody critique this first example? Human immunodeficiency virus infection and gestational diabetes. Hello? Hello? Please unmute yourself and critique this title. Hello?
It doesn't state the target population. Are you doing that in women between so and so age group or whatever? And also, it also states location too, where the studies to be done.
Very good. You see? Very good. So it's too short. I don't want it to be short, but it's too short. Not giving adequate information for me to be whether I want to be interested to go further about it or not. Because if it was HIV infection among Caucasian, I may not be interested. I may be a researcher in the tropics, and all what I want is tropical disease. Things that happen. So by the time I look at this, I'm not even sure whether it's in my area of interest. Yes, so you can see in the light of the question, the location is not there, the target population is not there, and what about it? Human immunodeficiency virus and infection, and what about it? You know, so when you start asking so many questions, your research proposal title should be so that you are just creating the curiosity. So, like, so what was all this infection among pregnant women? This is still not good enough. Sorry, who can help us? Somebody should unmute and just discuss what you feel about this title, this second one. Just unmute and tell us what you feel about that one. Hello?
Yes, sir.
Hello?
The second topic doesn't specify whether it is in pregnant women with a comorbidity or pregnant women in any particular facility. The location and the health status of the pregnant women was not stated.
Fine. Yeah, that's okay. So you just try to define your target population should be defined. Beautiful. Then
also,
the location. And what, sir?
And also the relationship between human immunodeficiency virus infection and what? A relationship between A and B. But there is something missing there.
Very good. Very good. So it should be a relation between something and another. You understand? Beautiful. So what I didn't even notice that, but it's also good that we noted it. What other thing? Okay. One other thing that I want us to look at here is, if you see what I wrote here, I said redundant words. You must be careful to avoid redundant words. When I say a study of the, everybody knows that a proposal is a study already now. Hello? Do you agree with me that a proposal is already a research that you want to get done? So now say a study of the, it's redundant. It's redundant. So you can just go straight to say what? The relationship between this and this. You understand? Or you now even start saying a proposal of the relationship between, all that, they are redundant because they are not making, without them, the title will still make sense. So anything, any word, I know you have very few words here. You want it to be as few as possible.
Well, that is,
hello?
I think it's to him, that analysis is inside the predators.
Okay, please mute yourself, mute yourself. So now, so that's it. So redundant word, that word is a study of the is redundant here. Okay. And as we said, you can bring in that cross-sectional study, a comparative cross-sectional study of so and so, a case control study of, or you write the title and at the end you put a column and now say a cross-sectional study. Put a column, a case control study. That is, you first write everything you want to write and now put a column and say a case control study, a cross-sectional study. It's allowed and makes your work attractive. And that's the whole idea. You are selling your work and selling your proposal, start from the beginning, from the title. So I think number 3 is averagely okay, but I know we can still puncture it. Said relationship between what? Human immunodeficiency virus infection and gestational diabetes mellitus among pregnant women in Lagos. You see, Lagos, anybody doing this meant that you want to recruit all pregnant women in Lagos. Although we know that one is not possible, but that means the person wants to sample everybody in Lagos. That means Lagos is the what? The whole of Lagos will be your sample, the whole of pregnant women in Lagos will be your sample frame, and the target population. Okay, so I'm sure next week we'll be able to, because those things confuse people to target population, sample size, sampling, but I'm sure next week we'll be able to shed more light on that. Okay, so fine, this is title. Please, just 2 minutes of interaction on title. Do we have anything, any comment or addition? Because as I said, it's interactive. And if you see our flyer, I was happy when the organizers made this so. So want it as interactive as possible, though we are using internet. So if you have any question, addition, please share with us. I must confess to let you know that most of what I say now, they are based on years of experience doing this, based on interactions among the audience, what audience have said before, you know. So I don't know it all. It's not that I know everything. But my own idea is just that the one I know, let's make it as simple as straightforward. That immediately you have this foundation, you can always start off and start writing, or whatever stage you are, you can review.
Someone has his hands raised.
So
I think he wants to speak.
and I shared the vision of the organization. Yes, my issue is sorry, can anybody guide me to how to start? I've not even seen those who that raise their hands again. I can only see chat. Okay, reactions. Oh, fine. No. This one
Dr. Olabi raised his hand.
Okay, so please, Dr. Olabi, please, you have the floor. Unmute yourself, yes. Please.
Thank you very much, sir.
Yes, my brother.
Sir, if I'm seeing this work, I made the example theory.
Yes, please.
Based on the fact that we have to use catchy word,
yes,
I will have used, instead of relationship, I will have used nexus between human immunodeficiency virus infection and gestational diabetes among pregnant women in Lagos. But I would have also preferred to add between so year, maybe between 2020 and 2021. The when, I would have loved to bring the when into it. I don't know if that makes sense, huh?
Dr. Olabi, I hope you all heard him. Dr. Olabi is I think you were part of us in NIMA. Are you the one,
no, sir? No, sir.
Oh, okay. Because there was another Olabi that was with us in NIMA and was very, very forthcoming, you know, interactive, and I really gained from. I really from your interaction now. That's why I was just thinking you were the one. So I thank you very much for this. Your comment. So any further comments or comment on what he has said before I now make some further comment? Any other comment? IPP.
I think Taiwo.
IPP. Yes. So,
and that person has his hand raised. Taiwo.
Yes. So IPP. That's the format we will follow now. You will be the one to be announcing them.
Okay. All right. So the next person, the next person with the hands raised can unmute himself.
What's the name of the person?
Taiwo.
Okay, Taiwo, please.
Taiwo, yes.
Unmute yourself. Taiwo, unmute yourself. Okay, let's move on then. Any other person? Said he cannot unmute self or host. IPP, please. Let us unmute him then. Or her. Please let us unmute her.
Try and unmute yourself.
He tried, he said it's not possible. So can you unmute her or him? Can as the host.
Yeah,
Just click on the host.
I'll try. Okay, see. Let me unmute.
I'm sorry for being slow. That's the essence of this program. As I said, most of us we've attended many programs. So the difference between that is because of, okay, let's just get the rubrics.
People have unmuted themselves. So
okay, maybe what you do for us, Taiwo, is that please
you can write in the chat box.
You can write in the chat. Please write in the chat box. We'll attend to it. So any other person, please? Another person? Another person? Okay, so let's quickly round up on this title. Yes, Dr. Olabi said that instead of using relationship, now why not use Nexus? Nexus, if we check the definition from those days, I didn't check now, but if we Google it, it's like to be something like maybe the link or, you know, yes, and it may also mean relationship. It may also mean association. But I come to submit to you that in academic writing, we, generally speaking, it's there's a narrow allowance for you to use your own words, especially like this one we're talking about. Sincerely speaking, Nexus is not as if it can mean the same thing as a relationship, but I recommend that you use words that we can easily relate to it as being academic along that line. Another word that I can suggest apart from relationship, this has covered my, how did it come by? Okay, I think okay, fine. So based on what you said, that's why I say there are some words that how would I say? I don't want to say you are totally wrong with that word Nexus, but there are some words that are more technical than the other. So the words that are in the scientific space more will be relationship. If you don't want to use relationship, you use association. Okay, you make it sober, simple, and smart. Okay, Nexus, for me to use Nexus, because I'm a mixed method, I'm trained in mixed method, I'll be dealing with exploratory work. I'll be dealing with qualitative studies. If I'm dealing with a qualitative study, yes, I can use Nexus. There are more allowances with words, with play around words, when you are in the qualitative space. But in the quantitative space, you don't have that liberty, you know, you don't have that spectrum of words, which we'll see as we move on. So those are the comments I want to make with regards to that. There was one other comment you made. What was it? Can you remind me? Sorry. Apart from Nexus, there was one other comment.
I mean the period. The period.
The period. For issues of period, yes, when you talk of epidemiological studies, we want you to add the period of the study. Okay? But if it's not purely epidemiological, like all these ones now, they are more of clinical studies. You can do without adding the period in the title. But you see here, as I said, when is also part of what should be in the title. But like my colleague that was talking about COVID-19 first and second wave, blah, blah, blah. He can put the period, okay? Because that's strictly an epidemiological study, okay? Then if you are dealing with maybe a trend study, yes, period of the study can come in. You understand? So let's be, yes, we can put period, but for clinical work, like for most of the part 2 studies, if you don't put it, you'll be fine. You know, we are talking practically here, but if you see where I wrote it here, when is also important. Okay, but we are we are trying to manage theory with practice now. Okay, now somebody that sent me, I was reviewing a journal article recently, and the person just put 2021 after everything. I just wrote 2021, and that 2021 looks so disjointed from the work. In fact, when we got to the methodology section, the data was collected between before 2021. So I have to query that, what is this 2021 doing in the title? You know, and I'm sure the person was like, they said we must always put time in our title and just put 2021. If you wanted to even put title, because it was a retrospective study, you could have put that period. Okay, and that's one other thing. Yes, retrospective studies, fine. Retrospective studies, yes, it may be incumbent on us to put that period. But this work, as we know, will be a prospective study. It will be a prospective study. If you put time period and you didn't finish your recruitment that time, what do you do? No, things like that. All right. So any further comments, Dr. Olabi?
Thank you very much for the explanation.
Okay.
The other comment is about the capitalization of words, like immunodeficiency. Should we start with capital letter and then the gestational diabetes? Use lowercase letter for them. I don't know if one should put uppercase. I mean for the capitalization.
Yes. Those ones, we don't have a hard and fast rule about them. You understand? So what I will suggest is, if it is apart from your first word, except it's a proper noun, just write everything as don't capitalize. Okay, even this human, I can avoid not to capitalize here, because human in the real sense is not a proper noun. So the only anything that I know in this place that yes, compulsory I should capitalize this relationship and what? And Lagos. You understand? That is one. That's a school of thought in quote, which I believe if the guideline didn't specify any other thing, you should follow. You only capitalize from beginning and proper nouns. Okay? So apart from that, no capitalization anywhere. But for example, if you write relationship between human immunodeficiency virus infection and gestational diabetes mellitus among pregnant women in Lagos, I put full stop. Then you now come to say a cross-sectional study or a comparative cross-sectional study. You've already put full stop here. You know that that A that will follow will be what? Will be a capital letter. I mean, you get that? So that's another. But as I said, there are other guidelines that will now specify what other words that they want capitalized. And for those other words they want capitalized, it will be specified in their guideline and you follow it. They will even provide an example and you follow it. And that's why, thank you, I remember that. Please, before you ever start off writing a proposal, a dissertation, you must also go and I will have to update this my slide. That slide where we say where to start, how to start. One other important document you must read is the guideline of that college. The guideline of that college. You must ensure you follow the guideline, apart from all what we have said. Yes, Dr. Olabi, thank you very much. You really enriched us. I'm very grateful. So we'll be expecting more of your interaction as we move on. So another
Dr. Patrick raised his hand. Dr. Patrick.
Okay, fine. Dr. Patrick, please.
Hello, sir. Good afternoon, sir.
Good afternoon, sir.
Sir, I want to ask, the word relationship, must it always be there in the topic? For example, do you have to compare two variables or two clinical entities? I'm an anesthetic resident. For example, if I have a topic like, let's say, I'll give an example, because we use a lot of drugs that are as anesthetics. So,
Yes.
effect of atropine in the management of hypotension-induced spinal anesthesia. So, like this topic now, there is no relationship between one clinical entity or variable to another. So, must there be a relationship in your topic? Must there be a relationship between two entities? Or can we have a topic like what I just gave? An effect of atropine in the management of hypotension-induced spinal anesthesia in FMC Lokoja.
You won't even say FMC Lokoja, you say among patients, maybe among you can either say among elective cases or among, you must still qualify it before.
Okay, sir.
You understand? But you get that, no problem. Beautiful. Thank you very much for that question. Yes, please note that that topic, as you said it, is perfectly in order. You can use the word effect, impact. Okay? But yes, to make, yes, make the work catchy. But one thing I want you to note is that for you to be able to come up with anything meaningful from that topic you just told me now, in your objective, you must compare. In your objective, you must get people that were on atropine, you must get people that were not on atropine. If you didn't compare those people on atropine versus those people not on atropine, you would not be able to come up to say, this is the effect of atropine. Okay, so if you just, okay, I gave atropine and this was the blood pressure, and so what? That's what we just tell you, and so what? Your study is a descriptive study. And most colleges now, they frown at descriptive studies. Because descriptive study, you cannot use it to ground any hypothesis. You cannot use it to come up with any conclusion. So your title is fine, but your methodology, please watch out for it. You must recruit two groups of people. One group will be people that had atropine. The other group will be people that didn't have. Okay. And then from there, you can now come up to say at the end of the story to say, this group had atropine. This group did not have atropine, maybe they had another drug. That what I'm now seeing with the blood pressure is because of atropine versus no atropine. And at the end of the day, what you are still doing is what? Is a relationship between administration of atropine and what and blood pressure result of blood pressure hypertension, which is still boiling down to what relationship or association. But please, yes, effect. Even my original study, the title was impact. Okay, how you get me? My original study was impact of HIV and or ART on glucose intolerance among HIV positive pregnant women in 2 tertiary sectors. You understand? But in my methodology, I compared HIV positive patients and compared them with what? HIV negative. Before I can say that that effect I'm getting is because of that extra thing or that exposure. So thank you very much for that comment. Yes, it's not only relationship or association. Effect, impact can come in. Thank you. So I saw one in the chat here. Based on the examples, I think relationship is too wide and should be further narrowed down. Well, really in quantitative studies, relationship is not that wide. Relationship just means we want to check whether there is anything, any association or any relationship, any effect, any impact between A and B. Okay, and it may be that the relationship may be there or it may not be there. So really, it's not wide. It's not. There are some words that are far-reaching that people use under qualitative studies. All right, so let's move on from title. So much about title. Now we move to another preliminary page, which is the abstract. Abstract of sorry, when should we have a break? Maybe every hour. So maybe by this 2:40, by 3, perhaps we should have a short break of 5-10 minutes. So that, this is adult education. Okay, so for preliminary pages, abstract or summary, sometimes it could be structured, depending on unstructured. Abstract too is usually written end of your proposal. It's when or your abstract is you want to sell your work. So that the person will read the abstract and get more interested. The person who read your introduction, your title was interested. The title was catchy. Like the title that my lecturer from local just said, it's a catchy title. Then from there, you now go to the abstract. The abstract too should be catchy, should encapsulate everything that your study is all about. And some people will always have problem writing 300 to 500 words about what their study is about. If you have problem doing this, okay, what is happening is that you must still go back to encapsulate your work. You know why it's important for you to be able to write a good abstract? One of the reasons is that when you go for exams, a simple question that they will ask you that you must prepare for is immediately you sit down after the initial pleasantries, they've introduced themselves, they have a chat with you. The next important question they will ask you is that, so tell us about your work. And they will tell you, you are telling them about that work in 6-7 minutes. You want to compress a study that you've written about 100, 200 pages. You want to talk about it in 6-7 minutes. So if you can't write a catchy abstract, you will have problem doing that. So that is why we must learn that how to write a catchy abstract. Let me give you a layman way of getting how to write or how to summarize your work. A very simple way is very simple way is to just say, okay, how can I explain this my study to my mother or my grandmother in the village? If you can explain your study to your grandmother in the village, or what you just said to her in abstract, you are saying it, she just sat down, you are not seeing her as physically, you just sat down and you just try to explain, because you know that to explain that to her, you won't go into so many details, just the key things that you explain, and that's the key thing you bring to your abstract. And that is all. And please note that some people, the abstract may be structured, so you have to check the guideline, or unstructured. It should be structured or unstructured. And then it could be 300, some may specify 300 to 500 words, that's the usual. Some may even be lower. I've seen a journal article, that said 200. Some people say 150. That they said 150 doesn't mean you know, what will I remove here now? It just means, it just helps you to further encapsulate what is the important thing of this work. What I suggest to you is that write it as 1,000 words. From 1,000 words, now start reducing until you get to, because as you write up to 1,000 words, it will have covered virtually everything that should be in the abstract. Then you now start asking from background, what is important? You read, you start removing something that are less important. It will be coming out openly to you. You'll be seeing it as you write, as you reduce. Sometimes you may even leave it, go, come back another day, read it again. You see some things to remove. And that's the way you keep removing until you want to have a compact abstract. Usually, as I said, you write it last. But the key things that you must know about abstract is that abstract also follows the same format of your full proposal. And what are they? One, you have a background. Two, you have sometimes you can even have the objective, the aim. You also have the aim. From there to the methodology. From the methodology to the result. If you've written if it's a dissertation, but if it is a proposal, it will stop at methods. But if it's a dissertation, you can now add what? Results and conclusion. So what is happening? Is there a cap of 100? We keep having 199, 98, 199, 98.
There's a cap of 100.
So that means if you are logged out, you may not come in again. Because I'm sure some people are waiting to come in and out. Maybe next week you will see what you are getting. Maybe next week you will get it. Maybe it will be bigger.
Yes, we'll try and make it bigger. Because I haven't been able to upgrade beyond 100 since we started.
So, and of course, we are not even expecting this large response. So we are happy about this response, and kudos to Igobi for putting up this. It just shows that it's an issue that is across board. Fine. So background. What should go into the background? What should go into the background is, if I wake you, if I just tap you and say, please tell me, why are you even doing this study? Why is this study important? 2-3 sentences is enough for you to tell me why this study is important. Why must we study this thing? And your opening statement. What I'm telling you now, go and read good abstract, that's how it should be. Your opening statement should tell us the body. Why is this study so important? And most of the time, it is about the body of this study. If we pick all the various titles we've had now, somebody is talking about predictors of mortalities of COVID-19. So what will you say? You can say that COVID-19 is a major what? Is the public health, is of public health importance in Nigeria. COVID-19 has claimed nearly 2/3 of its sufferers among our people, because that's why you want to check the mortality, predictors of mortality, so that you can reduce. You understand? So you must say something bad that will catch my attention. So COVID-19 is this serious? That will catch my attention for me to read further. If you are dealing with cervical cancer study, cervical cancer is the leading cause of death, leading cause of cancer death, or gynecological death, among gynecological cancer death among women. If it's breast cancer now, you see, breast cancer is the leading cause of, even if it's not the leading, it's not compulsory that everything you must study must be the leading. No. If it's the second leading, you put it there, is the second leading cause of mortality, or is the, you can talk about the mortality or you talk about the incidence. Like my brother from Lokoja, this drug now, I think is a part of your pre-medication, have you? So if it's part of the pre-medication, you put it there to see that pre-medication are very important preliminary drugs that must be used before spinal anesthesia to help to prevent morbidity and mortality, or to help to prevent complications from the condition, from the procedure. So from there, everybody knows that this is. So your opening statement should be something about the burden, about how important that study is about. Okay? You can write more than a page, but one very important one, you put it in. After you put it in, the next statement will now be fully about the justification. You now try to now come up to say things like, that evidence have shown, or it is rumored. No, not the word rumored. You can say that it's not yet confirmed with atropine usually have serious impact on blood pressure, on as a major cause of hypertension after spinal. Or it has not been documented. It has not been documented in our environment. Okay, so those are words you can use to show that it's important for us to now document this study, to document the pattern in our own environment. So usually the next line is like what we call a problem statement or justification. So you summarize your burden, then you summarize problem statement of justification, which you will see more as we move on. And that would be, so with 3 sentences, you should be fine with the background. Then from the background, you now go to the objective. You have so many objectives. So if you can just summarize the aim there, that is enough. Then you now go to the methodology.
Yes, sir.
Methodology, everything, virtually everything that you are writing about under methodology should still be represented in your abstract method under abstract. And what you should do is you now have to learn how to summarize. In one straight line, I can put the study design, I can put the study population, I can put the sample size, which I will show you some examples. Okay, so don't say because there is no time, no space, so I'll just write it. Everything must go in. And one area people don't talk about is they will not put the main statistical analysis they conducted. If you conducted logistic regression as your main analysis, you put it there. Logistic regression was conducted between this and this. If it was student t-test, you put it there. If it was survival analysis, you put it just one. Before you now go on with that, you are fine with the proposal. But for your dissertation, you now include the results. You've written so many tables, you have so many results, but it is the key results that you present. The key ones that you present. Okay? And please note that when you are presenting your results, the first statement should be descriptive. You should tell us about, if you've not mentioned it in the methodology, you should tell us the number of people studied. You should tell us about the mean age or median age. You should tell if it's male and female, you should be able to tell us the distribution of male, female. Minimum, you should be able to tell us gender distribution, age distribution. Okay, which you can do in one line before you now go into the core result. But people will just jump into, because I don't have time, I don't have space. Just jump into result. No. Into their main result. You must write at least one line of descriptive before you now jump into other aspects of the results. Then your conclusion, what I want to state about the conclusion is that I've seen people write conclusion based on what they just feel and not based on your results. The conclusion you must show in your abstract must be from the result. If the conclusion is based on result in the main work, that is not in the result, you must remove it. So what is that telling us? If there is an important conclusion you want to make, you must ensure that that result that will help you to make that conclusion is part of that, is part of the result. So everything you are concluding about, we must see it live in that result section. So, but people do, I just laugh. So please note that. Let me unshare this and see for structured and unstructured. Structured, you see it now. Structured means that you write background, you write what background is. You now write method, you write the method, result, you write the result, conclusion, you write conclusion. That's structured abstract. But unstructured means that you will write everything, you write result, background, method down, but you will not put background and everything in there. So what I advise people to do is, even if the guideline says unstructured, first structure it. And after you've structured it, just remove background, method, result from those titles from it. It becomes unstructured. Okay, so let me just share, let me stop this and share two abstracts for us to just see. Yeah, so it depends on the number of pages. Here you see that a lot of. So what do you think this is? Is it structured or unstructured? Can you see my slide, please?
No, sir. You can't see a slide.
Okay, sorry, I will get it out now. Oh boy. Okay. Can you see now? Can you see? Okay.
Yes, sir.
Fine.
Can see.
So fine. So this abstract, is it structured or unstructured? In fact, let's start with structured. Please, I'm sorry. Let's start with the simple to the. No, stop. Can you see this? Can you see where my? Can you see?
Yes, we can, sir.
Yes. So, if you look at this title, can you see the title? Hello? You can just type yes in the house so that I can. Okay, thank you. So you see a title here, Predictors of In-Hospital Maternal Deaths within 120 hours of admission at the Lagos University Hospital, Lagos, Nigeria. This is another title that is also saying the same thing. 120 hours survival experience of maternal deaths at the Lagos University Hospital. Do you understand? Okay, so now this title, that is the abstract for that title. You see the first statement there says, an efficient, comprehensive emergency obstetric care can considerably reduce the burden of maternal mortality in Nigeria towards achieving the sustainable development goal. So evidence about risk of maternal death within 120 hours of admission can be a surrogate of the quality of outcome of comprehensive emergency obstetric care offered. So I want to sell this paper. And to sell it, what do we say? We want everybody to know that comprehensive emergency obstetric care, if we get it right with it, we will reduce maternal mortality drastically. For those of us in O&G, that is our goal. That is what we preach. So anybody in O&G that is seeing that will be happy, say, let me read further about this paper. So that is a catchy thing to draw people closer. Then I now brought in the maternal mortality, our study, to say that if we have evidence to show how baby women survive within 120 hours of getting to the hospital, it can help us to know about the emergency care they received. Because when anybody read that title, we wonder, what is this people talking about? What the hell is this topic? What the world want to? Well, by reading this background, they say, okay, then you now put the objective. Then from the objective, you now go on to what? Methodology. In this first line of the methodology, you see what I said. I will say everything can go in there. We conducted a retrospective core study. We've thought about it. This is the study design of 435 consecutive maternal deaths. 435 is what? 435 is the sample size. Consecutive is already telling us about the sampling technique. So in just this straight line, what have I done? I've mentioned the study design. I've mentioned the sample size. I've mentioned the sampling frame, sampling technique. Maternal death, I've mentioned the people studied, the target population, and the location at the Lagos University. And what? And the timing. And how did I carry out the stuff? Using data from this. So that was my method. That was my procedure. And then I say survival analysis table, Kaplan-Meier plot, cost proportion, all those things is not talking about what the statistical analysis method used. Do you understand? So you can innovatively, when you read other people's abstracts, with this mindset, you'll be able to write yours. And then from there, you see the results. Now you don't need to state the sample size here again because you've stated it upstairs. Then you start with what? The mean age. They are all female, so you don't need to start telling us about this. So the mean age is this, and the median time to death, which is your core outcome. Your core outcome is how long they stay before they die. whether we could have saved them. So that's what the study is about. Okay, then I now put what conclusion. Everything that I've written in this conclusion, must be derivable from this result. Anything that is here that is not in this result must go. I must not just think about it. Even if it is in the main result, no, it must go. So this abstract is a structured abstract. Okay, so I will stop it. And then now go for this. This is an unstructured abstract. You didn't see background, methodology. This is it's not there. So this is an unstructured abstract. But as I said, an easy way of writing it is write a structured one and just remove background, remove objective, remove, and just join everything together. Okay, so you see it here, whether we like it or not, everything here is still about the background. Cervical cancer is the leading cause of female cancer morbidity and mortality in South Africa, despite the introduction of preventive programs. However, there is, so this one is what that body. We now quickly brought in the problem statement or the justification. However, there is a paucity of information on the current cervical cancer rate and trends in South Africa. Then what do you now put to end it? This study aimed to evaluate that. So what you are writing as the aim should be able to follow from your last statement, so that you can even put here. Another word you can use here before the aim is to say, hence, we studied this. Therefore, we studied. So you know when you want to say hence or therefore, the sentence before it should be joining together. So if there is paucity of information, and I know there is paucity of information, then now I want to provide the information. That's why I'm not studying this. So that's the way you structure your abstract. 3 sentences: 1, body; 2, justification or problem statement that will now lead to the aim of the study. They have said that you can now go on to the methodology. You see it again. We conducted what? Temporal analysis. That is the study design of what? A standardized rate, blah, 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 using data from, because this is a secondary data analysis and all that. And then you now start talking other things. After that, you now go on to what? The results. You see? So in the results, now stated the number of incident cases, mortality, you know, and now start saying with so and so below 40 years, blah, blah, blah. Okay? So even if this study, this program ends now, I believe we are gaining something. Then from there, this last part is now talking about the conclusion. There is one thing here, there is one statement here that is also, I didn't mention, that if you like, you can include in your abstract. That is something about the limitation of the study. This first part is the limitation of that study. The incidence and mortality of cervical cancer are probably underestimated due to underreporting of cancer in the country. So that what I've even reported, so that's a limitation of the study, so that whatever I've reported may not be the whole truth because of underreporting. So from here, I now start saying things about what I've reported. Cervical cancer, South Africa had minimal changes in overall cervical cancer rate. This statement was obtained from here, you know, and that. So everything you have to say, your conclusion should be based on so that's thank you. So that's it for for showing us examples of abstract. So this one now is depends on the number of words. That's why it's a bit large. If they say we should compress the same thing to 250 words, you do it. You just read it again, read it. So you can write 1,000 words, start cutting it down, summarizing it further until you meet. So please, if you are presenting abstract for conferences, part of what we mark is for you to keep to the number of words. No matter how good your abstract is, you may lose mark and your abstract may not be accepted because you didn't keep to instructions. So you must keep strictly to instruction. If there's a 200 words, if it is abstract for conferences, make sure it is 199. Don't exceed 200. But if it is journal article publication, if it is 200, if you go for 203, 205, it will still be allowed. Okay. Then for proposals or dissertation, most assessors, if it's also 200, you go for 245, 207. Nobody they will allow it. They will allow it. So let me share my screen again. So with these few points of mine, we're going to come and presentation. But as I said, the abstract, usually you write it at the end of a proposal or at the end of your dissertation. You can't write it before that time, but it will always come before. And you should write it well so that it will be catchy and it will be able to steal the attention of the audience. So please, if there are questions, you may ask via the chat box or by show of hand. The next, we just take that for another 2 minutes, 2-3 minutes, then. So are we counting the result figures as part of the word for abstract? Yes, sir. The numbers you've written in the result section, everything. If you've written 235, 247 is a word, okay? Everything like that is counted. It's counted. Yes, another question is, should recommendation be part of the abstract, sir? Recommendation can be the last sentence. You may not necessarily say recommendation. Recommendation can be the last sentence in an abstract because that's your conclusion. You can conclude, say you find this, this is what, hence you are recommending this. And that's where people run foul. They will recommend things that are not from the result in the abstract. There may be a recommendation they just carry from the main body of the work to the abstract. No. Any major recommendation that should appear in your abstract must have results that is supporting it. So yes, thank you. Recommendation can be part of the abstract. Usually you can build a case from your conclusion and you now say you recommend this. But it's not in all cases that you must recommend. Any other question? Thank you for all the comments. They are enriching us. Another question, please. Okay, if there is no question, I think this is a good stopping point. I think this is a good stopping point. So we can have a break. We stretch our legs. And when do we suggest we resume? We stretch our legs, take a cup of coffee, and then we resume. You see, yeah, the idea is, as I said, it may appear slow, but I always want us to get each concept as we move on. Okay? Even if we don't finish here, that's why I told the organizer that at least we should have at least 2, so by next week we continue. Even if we don't finish next week, we will still find another time to finish it. But everything we do per time, I always like us to understand and get it before we move to another thing.
We can resume by 2:30 and 3:30, 15 minutes break.
3:30, okay, great. So we're on break now, so we resume 3:30. Thank you.
All right, sir. Thank you very much, sir.
Thank you. So we resume 3:30. We were prompt. We started promptly today. So please, 3:30, 3:30, not 3:31. Okay, so far so good with the introductory part. So now is the want to start the actual, as I said, several things you've said before now, you'll be writing as Roman figure. But from now onwards, it now becomes what's it called? Arabic from background. That's introduction, background. So the introduction will be usually divided to background, justification, problem statements, and literature review. So it depends on the guideline. Some guideline will put all of them under introduction. That is background, justification, problem statement, and even research questions and literature review. But some guidelines will say no, that introduction should only be background, justification, and problem statement. Literature review should be under chapter objectives, aims, objective, hypothesis, and all that should be under chapter. So for you, as we said, you need to check the guideline to know which one to follow. Okay. So under introduction, the first we want to write about is the background. This background, I've said that's why I intentionally did it. I'm repeating it again, is similar to the background when I was discussing about abstracts. The background should not be more than 2 pages at most, 2.5, shouldn't go beyond 3 pages. 2 pages is okay. The reason is because by the time you are writing more than 2 pages, you will lose your audience. You start saying things that are irrelevant. There is no way you'll be able to write more than 2 pages of relevant things and it will still be background to your research work. Okay? So for you not to run the risk of losing your audience, so that they will start getting on the nerve that what's this? Why is this writing all this? What's all this? Keep it simple, focused. So from beginning, by the end of the second page, even when the person is thinking, oh, let me see here more or read more, You have finished your background. It's potent and straight to the point. And what are the things that should be in the background? As we said, you want to introduce the subject of the research to the audience. You've tried to do it with your abstract. Now you want to go deeper. So you just want to open up the same way as I said. The opening statements could be a definition. For example, if your studies about HIV and GDM, you may decide to define gestational diabetes mellitus in your opening statement. It may be a definition. That's the opening statement. You may decide to say, HIV is a retrovirus of the so and so family diseases. If you are doing HIV and gestational diabetes. Okay? Those are ways of starting off. Because the usual thing is sometimes is that inertia. What should I write? So that's the way to start off your background. But for me, my recommendation is that start off your background with things that will show the body, that will show that this study has a huge, this topic has a huge place in medical science or in orthopedics, in O&G, you know. If your study is about preeclampsia, you can start off by telling us that preeclampsia is the leading cause of maternal mortality in our environment. And you start quoting the figures. You see that in, if it's globally, you can quote it and say globally, you state it. And from global figure, you come down to Africa, you state what it is. From African figure, you come down to Nigerian figure. And if you have Lagos, which is your center, you go down to Lagos. And as you are going down, you are comparing to see that preeclampsia is more in Nigeria than among women in Nigeria than women in the US. This is this, you know. Those are the things you are supposed to do. Those are the things you are supposed to do for your, that's the introduction of the introduction now. That's the opening statements of your background. So the opening statement of your background should involve you talking about that huge body of, if you are studying about HIV infection, you talk about it. HIV, blah, 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 so and so number, prevalence, number, burden, mortality, incidence, you know? So when you've painted that picture, before you know it, one paragraph is sorted. You know, where you paint the global picture and the local picture, one paragraph is sorted. Then from there, you can now come down to say, okay, let me pick another important concept that I want people to understand. Like somebody dealing with HIV and GDM, I will talk about HIV in my first paragraph. My second paragraph, I'll talk about GDM. I'll define what GDM is, talk about briefly the criteria being used to diagnose GDM. I'll talk about the incidence globally in Nigeria and everything. Then, since I know that the study is about screening, whether to be able to include HIV as part of the screening factors, I cannot leave GDM like that, talk about it. I can even now add to go on to say, how do we even prevent GDM? We screen. How do we screen patients or manage, we screen them using social and so factors and everything. But however, we know that HIV is not yet a factor. Then, and when you are writing background, you should be smart. No long story, anything that will make you to give so much details, remove it. Just summary of the core thing that you want anybody that when they finish reading your background, they are a bit relaxed about what your topic is all about. Okay, so from like that GTM, I will now go on to say, okay, what is the pathophysiology that is linking GTM and HIV? I will talk about that briefly. And by the time I finish that, and maybe add 1 or 2 other paragraphs, I will be able to write 2 pages. Don't write long introduction. You will lose your audience. So those are the basic things that are expected to be found in your background. So you see, by the time you are done with all this, you won't say you don't have anything to write. You'll have written enough. Okay? So generally, you want to just summarize what is known or unknown about the topic, just in a nutshell. Okay? And then at the back of your mind is that you want to still convince your audience further. Hello, what's happening? Hello? Okay, that there is a big deal about this topic. So that is basically what background is all about. Now, practically, how do we get around writing background? A way of getting around writing background is when you internalize these ideas of how I say a background should flow, what you are supposed to now do is in your head, you can read journal articles that have been talking about what you want to study. Most of the things you use to populate your background, they are likely to be found in the introduction of those journal articles. So you can pick like 10 journal articles and just read through all their introduction. As you are reading through those introductions, you will be getting inspiration on how you to form your own background in the context of all these points I've listed. Like if you are saying, okay, my first area, I want to talk about the burden of the disease, the this, the that. So what will you do? When you go and read an introduction, all what you'll be looking out for will be prevalence of that condition. You go to another, and you first check for prevalence globally, then you look for prevalences in the prevalence in the local, and then you will compare it. Okay? So from there, you now go on to basic definitions and the explanation of those definitions. And now it's applied to what you want to study. Everything you are saying must find a way to relate it to your title. Then from that one, you now go on to pathophysiology, a summary. What I discovered is that when you say people should have a pathophysiology in the background, they now go to town, just be talking and GDA and this one will form this, and this will form this, and this will form this, and that will now thinking that those details will impress the audience that you've read so much. No. Just say the initial stages, and you jump and say from here there will be several combination of stages that will not lead to so and so at the end. Okay, so when you're writing the pathophysiology, please keep it brief so I don't lose your audience. People easily lose their audience when they are writing background. So we finish with background. What we can do is, let me share, if you will allow me share right away, to just see some background again. Although this is a journal article, but we can still see. So this is the journal article of that paper on the introduction, which is not a background, although it's a bit different when you are talking about this is a journal article. Because in a journal article, you are expected to write the background. Apart from writing background, you're supposed to now add even basic literature review, justification, everything should be in the introduction. But let's see how this one flow. I'll just show you some example of what is there. So you see the start of there. Globally, about 830 maternal deaths occur daily. So by the time anybody is hearing that 830 women die every day from maternal deaths. So it's a major thing that we need to talk about, with 99% of them occurring in low and middle income countries. So that one, is you are letting people see the need for this study. So according to what estimate, blah, 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 now you talk more, before you now come down on Nigeria, state some of those statistics. So from there, move on to type of maternal death. You see, 90% of causes of maternal death, and most they are preventable. What are the common maternal deaths in our environment? It's listed, like that. So that's how you'll be building. In this type of work, emergency obstetric care is related. You see, everybody bringing it in. Okay, and from there, you see here, emergency obstetric care may be basic or comprehensive. So you are not leaving everybody in the dark. So even if you don't know what emergency obstetric care is, you are letting them know. You can even in this place, if it's a thesis or proposal, you can define emergency obstetric care fully in your background. Okay, so like that. So that's the way background is structured. I'll show you another one. So you see another background. Cervical cancer is a largely preventable disease, yet the global incidence is high. Approximately 5,000 days with about, and those figures are available. When you Google, you see materials that will state those figures. So you see how from global figures we start stating down to South Africa, because this one is about South Africa before we now ended with South Africa study. Okay, then from there, we're also talking about trends. So we now start talking about trends, whether it's going up, coming down, based on the research. So that's how, see, just 2 paragraphs. But I will suggest you can make it 2 pages. This one is, because Nigerian people may think it's too short for background. 2 pages. So I will share one more to just start and start writing. And as I said, in your field, you can decide to get papers. You see a good work or a background. So this is a study of impact of HIV on glucose tolerance in pregnancy. That's the background introduction. Background. HIV has over the years assumed the global pandemic with sub-Saharan Africa, including Nigeria, being greatly affected. And estimated this, like that. Estimated this now live with HIV, and 7 million people now live with HIV, and about 54.4% of the global population of people living with HIV live in the sub-Saharan Africa. So you see, there is a major issue to be researched on. Currently about 1.8. So that's the way you write. Everything about down to by the time you look at the second one, now it's now going to, okay, HIV is linking up. So, okay, HIV make people to now start taking drugs. So when they start taking drug, what will happen? When they start taking drug, therefore the potential complications associated with HIV infection and its therapy during an outside pregnancy deserve attention. So why does it deserve attention? HIV is a multi-systemic disease with potential for alteration of endocrine and metabolic function. Like that. We've talked about HIV, how HIV can cause problems. They're not talking about how pregnancy will cause GDM. Pregnancy itself is a diabetogenic condition due to the hormonal conditions and this. You understand? So that's how you build your case. Okay, so just follow that format. By the time you usually, as I always say, the major issue people have is that of inertia to write. What should I write? So just follow that pattern. Each of those statements I've stated in that in the slide. Just find a way, read materials based specific to your topic, and you populate it. So by the time you pick each of those things I've said and you populated them, you'll be able to write your background. Okay? So background should be ensured that by the time you are finishing, we are much more clearer on why this topic is really of essence to us. So let's go back to so now that is background for us. Are there any questions or comments or further addition on background, please? Any further comments or addition or, No question. So we are fine.
There's a question in the chat box, sir.
Okay, so please, can you clarify between introduction and background? Fine. Introduction and background, anytime you write a background, then you know that it is part of introduction. But there are occasions that introduction will be synonymous with background. So let me explain. Sometimes people will say introduction will include background, justification. So you write on top, that's chapter 1, introduction. And under that chapter 1, which is introduction, you write background, you write justification, you write problem statement, you write research question. Everything together like that. That's background, research question, justification, problem statement. All of them together, they are introduction. You are introducing your topic by writing all that. Okay? But there are occasions which is common now with journal article, in which everything like that, you just write it, you won't break it down, there won't be a background, you just say introduction. So some people, where they are supposed to write background, they may just call it introduction. But truly, it is not introduction. Introduction should be everything from background to justification to problem statements. All of that together is what it should be introduction. As I said, we interchangeably use background to mean introduction. Background is supposed to be just a component of introduction. Thank you, sir. Does justification come before problem statements? That's a good question. Well, if I'm to arrange it based on how the thing should flow, I will suggest problem statement should come before justification. But as I keep saying, check your guideline. If the guideline says justification should come before problem statement, you do so. If problem statement should come before justification, you do so. But if it's not, please just maintain that form. I would prefer problem statement before justification, which you see the reason very soon. Okay, so now we are moving on gradually. We are now on problem statement. The problem statement is stating the problem. It's as simple as that, Abby, but it is not. So the problem statement is stating the problem. Whenever you have a research question, there is supposed to be a gap you want to fill. There is supposed to be a problem you want to solve. Like all the titles, all the suggestions we have today. Here, you are talking, a title says predictors of mortality of first and second wave. The problem statement here will be that we don't know those predictors. So our work want to fill in that gap, to know the predictors, so that if we know the predictors, it will help us in what? In clinical care of the patient. If we know that a patient that is diabetic is likely to die faster than the one that is not diabetic, what will you do? You will make sure your intervention, public care intervention, you focus more on the diabetic patient. I warn them that they should never go near where they will get COVID because they are likely to die faster than the non-COVID. So that's a good reason why you want to know the predictors. Is it that some people, the time to death, what is it like? You know, even predictors, all this stuff, all these analysis may be, it's okay, want to know what is the cost implication of treating these patients. So you have to bring out those problems that you feel your research will fill directly. Those problems, those gaps that your research, so it's a summary of all of them. The summary of all those problems that your research will fill. More examples. Now, the issue with problem statement is, how do I write it? How do I get ideas of the problems? Because if it's just one problem, then I will just write one line and that is all now. Whereas a problem statement should be an average of, say, two paragraphs or max 3. 2 paragraphs is okay, 2 paragraphs. So it shouldn't be more than a page, problem statement. What are you writing? If it's more than a page, then that means the research should be split into two. That means the problem you want to solve is more. So I've listed some examples, some ways of you being able to get things to write about in this problem statement section. So one of the first I wrote there is what specific problems or gaps did you identify that you hope your study will fill? You write it. But in a way, when you are writing it, there are very nice way of writing that you won't just say, hey, the problem I want to fill is that there's no water. So my research will provide water. The problem is number two. The problem I want to fill is there's no jerrycan. So no. You must find an innovative way of writing those things. And to get those innovative ways, that's why I listed this one. One way of doing it is you can state if others had raised the problems but not solved, or it was half solved. For example, you might have read a paper in which the person just recommended that, my study, we couldn't do this, we couldn't do this. So you just say that researcher A et al. Studied HIV and pregnant women and found that HIV patients have this. However, they also stated that they didn't know this. So this, my research study, is to fill in this extra gap that have been identified by researcher A in their study. Another one could be that, you see, as usual, most research are building on existing ones. So yes. So another way is to first paint the picture of what is the current state of evidence on what you want to study. So after stating the current evidence, you now say, however, we don't know about this, which is what my study want to fill. So as I said, yes, you advise. So even when you are writing, so probably just not just going straight to write problem. You talk about advances, things that have happened in that area of study. You now put, however, this problem, or we are still ignorant about this one. And what you are ignorant about may be ignorant about it in our environment. It might have been documented in England. And I say, however, it's been documented there, but we don't have any evidence, locally produced evidence on this topic. Okay, then you see, so those are the ways. So at the end of the day, writing a problem statement with this template shouldn't take you more than a day or half a day, because you are not writing so much. And you have written it, you've gone past that one, you are moving to the next task. But you must write it the way it should be written. Okay, so the last one said, you may also build a case by stating the historical progress made on the innovation or knowledge, and then quickly show the opaque area, the areas that are not clear, that you want to unravel. So those are the ways you try to paint your problem statement. So because of this, most good problem statement, you have things like despite, in spite, Hello? Hello?
Yes, hello, sir. We can hear you.
Okay.
Yes, we can hear you.
Okay, somebody said we should send the recorded version through this. Anyway, the organizers will know what to do. I want to see whether I can get more comments. Okay, is there a need to write about connectivity between variables, e.g. HIV and DM? Sure, you must write. That's where the pathophysiology comes in. Pathophysiology that is joining, pathophysiology of the condition we want to study, that is joining HIV and DM. Yes, very good. Yes. What? Okay. All right. So what's like despite, but however, there are common ways of bringing out your research problem. You first state what is obvious. Now say, however, this one is not in the literature. It's not available, and that is what you want to feel. You state what is obvious again. You say, despite this, we don't know this. You said it, but you know. So those are innovative ways. So when we see those things, we know that yeah, this person is writing a well-crafted problem statement. But the key thing is you just want to show us your gap you've identified as problems. So let's quickly look at the examples again. So when you read problem statement now, you can now read it in the light of this. Okay. These things just for us to understand these basic principles. All right. So we have this problem statement. There are high rates of cervical cancer in South Africa, despite the current effort to reduce its incidence and mortality. In 1994, the International Conference on Population and Development stated that sexual and reproductive health should be a human right. However, most countries in SSA concentrated on the prevention of maternal and perinatal mortality, but neglected reproductive health cancer. That is what we want this our study to feel. This neglected thing, which is supposed to be part of reproductive human rights, is part of what we want to feel. Another paragraph says, South African government instituted cervical cancer population-based screening program in 2000. That's intervention. And vaccination of school girls against human papillomavirus in 2014. So all these programs is to help to what? To prevent what? Cervical cancer. They started screening in 2000. They started vaccination in 2014. Then the next was that resources have also been invested towards the control of human immunodeficiency virus and tobacco smoking, which are risk factors of cervical cancer. So it is expected that these measures would impact on the temporal trends in the risk, incidence, morbidity and mortality of cervical cancer in South Africa. So this last part is what you question the research. Sorry, somebody is using two to link up. So one is going into the other, and we are now hearing. That's why we are getting that noise, please. So we have that. So that's the, so this last part is now the problem. Is now the problem. All these are interventions that have been done, but we don't know whether these interventions have any impact at the population level on cervical cancer. So that's the problem we want to solve with this paper. So you now see, currently, there is paucity of what? Published data with robust data analysis. So even if there are published data, they don't have robust analysis of the trends and predictors of what? Incidence and mortality of cervical cancer in South Africa. So you've now come out to state in black and white the problem that you want to fill. You went on again to say previous studies of cervical cancer in this were either hospital-based or conducted to monitor only trends without mortality. So you are still furthering to let people see why this study is important, because yours, these are limitations. So but your study will now address these limitations. Your study will now address these limitations. So from there, so that's the way you build your case when you are writing you build your case when you are writing a problem statement. So you can get it from literature, you can get it from the limitations, you can get it, so anything that will just create that gap, you write it nicely to create the gap that you want to fill, So that's how literature review problem statements goes. And max, half a page, 2 paragraphs, 3 paragraphs, maximum 3 paragraphs. They are done. So that is why when people are struggling with the proposals and all that, I'm sure the thing here is just that inertia. What exactly will I write here? And you don't need so much with background. As I said, 2 pages, you're fine. Problem statements, half a page to 1 page, you're fine. Just coin it well and let it be sweet. So by the time anybody reads your problem statement, it's getting clearer why this study is important for you to do it and the gaps you are creating them. Now for justification, it is also called the rationale of the study. It's also called the rationale of the study. For rationale of the study, what is it about? The key thing about the rationale or the justification is that what is in this study for humanity? Let me put it that way. What is this study going to contribute to humanity? To the expansion of medical science? Some people will think it's almost like opposite problems. No, it's not. Okay? So now what you are doing is you are trying to let us see that, if this study say true, like that my study that I was talking about, one of the strong justifications is that we all know that GDM is a problem. If it's like that, if we can, so one of the things I can even put there here. Usually you'll be seeing words like if, because you first say if this, if I found this, then it will be this. If I found this, because you don't know what it will be. Whatever way it is, if you find this, if my study document this, then it will help us to do this. If my study does this, then it will help us to find this. You know, things like that. Your study can even come up to say, the study can even still come up to say that, oh, if I can document this, is a good way to also be able to do another study. Okay, like the atropine stuff, if it's not yet widely used like that, you say that if my study found this, then it should be a reason for me to recommend that we should be using atropine in the hospital. If my study found that atropine is dangerous, then it's a reason to recommend that we should not be using atropine again, so that it won't be causing this. Okay, so you want to let us see that your study can improve guideline, improve humanity, improve care of patients, improve this in that particular area of need. Okay, so you must, and that's why I say this is the most important thing for a study. If your study won't improve what is in the literature, it won't make us change what we do every day, then most of the time it may not be worth the while. What your while, what the while of the patient you are recruiting, the participant you are recruiting, what your time, what's the time of all the reviewers of the work, and this money you spend. So please ensure that you can justify your study. You can tell us the rationale. And when you are writing it, as I said, if there is no way you write a whole justification, a good one that you won't put if. So if this is this, then we do this. If this is this, then we do this. So that's a justification. So we people, you are using this, you are asking for recording to disturb us. Don't worry, after the whole program, we'll decide how we can go about it.
We'll work on that after the program.
Yeah, so don't worry, if that's what you want to post, don't worry posting it. It will give you instructions, specific instructions related to that. Though sometimes one thing that have happened to me in the past is people will take some of my work like that and use it without recognizing the source again, which is plagiarism. Some may even sell it, turn it around for sale. But no problem. We won't say because of that we won't promote knowledge. But it has happened to me several times. All right, so let's move on. So please, let's use the charts to engage on what we are doing. Okay, so let's ask questions. As we ask more questions and we explain further, we will interact on what we've done. Okay, so that's the justification. That's how to attack justification. Let me see if I can get some justification here. Some materials for justification. Let's still go back to this, but after that we'll check other ones. So we see justification. Then you see sometimes, I must confess that there can be overlap between justification and there can be overlap between justification and what's it called? Justification and problem statement, and even background sometimes. But please avoid the temptation of repetition. Avoid the temptation of repetition. Okay. So justification here says South Africa is currently undergoing demographic and health transition that mirrors the high-income countries. Also, there has been a shift in the morbidity and mortality related to HIV infection, largely after the nationwide rollout of these diseases. You see now, this is not the justification. It is important, based on this process that is happening in the country, what is it? It is important to document the baseline incidence mortality of South Africa in order to track the progress of initiatives aimed at reducing the incidence and mortality based on all this. So you have such programs, blah, 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 blah. It's almost like stating part of the problem statement in another way. So you see, although there are concerns about the quality of national data and the incidence of mortality, it is still worthwhile to document the current trend and evidence based on available data, so as to guide policymakers who are saddled with the responsibility of designing cost-effective prevention strategies. After all, the WHO encouraged member states to formulate locally relevant cancer control programs after reviewing evidence from their locality. So if there is no evidence, how will you formulate policy? Okay. So that's the, you see it, short but potent. Let's see whether we'll get another one. Okay, sorry for taking us back a bit. I just want to show us this, the background here. It's a very interesting one. It's always even looking like a justification. You can turn it around and use it for. So you see, that's a study on HIV and GDM. So you see the background here. So with the introduction of ART, patients living with HIV now have increased life expectancy and improved quality of life. However, there are growing concerns about increased prevalence of metabolic derangement among people living with HIV, which may be because of the virus or the drug. Such increase in prevalence of glucose intolerance may impact on their pregnancy outcome and on the pre-MTCT program. So this here, apart from the first, this one here looks more to me like a problem statement. Looks more like a problem statement that will now lead to the objective of the study. So let's look at whether there is a justification here. Tap on the, you can see the justification here. The justification here, let me see. So by next week, it will be more interactive. I will prepare good ones. I will just prepare a page, like 3 ones, good and bad, good and bad of all what the areas we discuss, so that we can see it. This one is just introduction straight down. Okay. Okay, this is justification here. I think this study is talking about HIV, the nexus between HIV, pregnancy, and lipid profile. That's dyslipidemia. You know, some people may wonder, what do I want to know? Why would I want to know the lipid level in HIV patients? You know, you must justify it to a layman. What for? Why must I bother myself about knowing whether it is high among HIV patients than normal people? It is justification that you must use to counter anybody that want to say, no, it's just a useless topic. So please take very serious note of justification. So you see, justification for such a topic. So hepatitis disorders are the leading cause of maternal mortality in Nigeria and globally. Also, HIV infection contributes greatly to the national and international statistics of indirect maternal deaths. Although CVD, cardiovascular disease, is now a leading cause of death in SSA, however, SSA has poor records on the social demographic and biological determinants of CVDs. Thus, the sub-region is poorly prepared to tackle this emerging non-communicable disease. Well, you may say, okay, that's in the people that are not pregnant, but you should also know about it in the pregnant. So you are building a case. Repeated exposure to atherogenic cholesterol in multiparous African women may predispose them to CVDs. Therefore, pregnant HIV positive women in our environment may have a higher risk of developing CVDs because of hypercholesterolemia due to HIV, ART, and other factors. So it is important for us to know. But if they have higher level of cholesterol, they may be at risk of developing cardiovascular disease. So we see the present study can provide evidence for counseling on postpartum contraceptive choices of HIV positive women, because there are some postpartum contraceptive choices that can impact on lipid profile. So if you know them, if this study proves that they may have higher one, then it will affect the kind of counseling we give to HIV patients. See, this is because hormonal contraceptives have a theoretical risk of causing what? Metabolic syndrome during pregnancy. Thus, the body of dyslipidemia among HIV positive pregnant women in our environment is worth investigating in order to aid counseling and prescription guidelines on subsequent reproductive health in the HIV positive women. Some I intentionally wanted to read so that you can just see ideas of how people can come up with how to justify a study. Some epidemiological studies have shown an increase in the prevalence of dyslipidemia in HIV positive women and men outside of pregnancy. However, these findings cannot be extrapolated directly to pregnant positive women. So, because of that, we need to know what is happening among pregnant women. Okay? So that's there was even one that said that, I think it's here, that if we prove that dyslipidemia is higher among HIV patients than none, that it may be a reason to start introducing low-dose aspirin among HIV positive pregnant women. You know, so these are ways you can write, but you must justify your study. If you don't justify it, no way. People will not, it will not fly. You must be able to tell us why this study is important. Why is important to humanity, to management of patients, to improve care, to whatever. Please. Okay? And that one too, maximum of 2-3 paragraphs, we are fine. And please, it is not the opposite of problem statement. So now from justification of the study, we now move to, sorry, can you see my screen? Can you see my screen?
Yes, we can, but we prefer it in the slideshare mode, sir.
Okay, thank you.
Okay, thank you.
Okay. Now, I must say, from my experiences and everything, that the most difficult part of a proposal or dissertation is the literature review. And for me, if I must advise, if I must recommend, start from the simple to the most difficult. Write your title, write your background, justification, literature, problem statement, even jump literature review and go to objective, state the objective, state the specific objectives, go ahead and do your methodology before you now balance and start working on, before you now balance and start working on the literature review. Yes, I had a question here. The question was that, what about aims and objective? Yeah, so if the guideline says you should state the aim and objective before literature review, please go ahead and do so. Okay, go ahead and do so, but we still get to aims and objective. So for literature review, as I've said, for me and for most of the people who I've worked with, literature review is the most difficult aspect of the whole dissertation or proposal writing. So because of that, I always suggest that people write this last. But if you can write it first, so no problem. There is nothing. The key thing is that when you finish everything, you arrange it as you should be. But what is a literature review? Well, it has a definition, but the key thing is for us to know what to do when we get to literature review. Literature review is really an in-depth examination and discussion of the previous literature on the topics, on the title or topic, so as to have a good foundation of the current state of knowledge on the topic of the research. If you've written your literature review very well, ladies and gentlemen, if you've written your literature review very well, most often than not, you become an authority on that aspect of the work. You will surely be an authority, because by the time you finish writing the literature review, you are picture in your mind that you want to write a mini textbook on that aspect of research. I must quickly say that when I tell people that you want to write a mini textbook on that aspect of research, what people will now do is to go and carry a textbook. I just copy it on like the topic we just discussed. We're talking of HIV, association between HIV and GDM. It is not everything about HIV that will be in your literature review. No. That you must discuss in depth in your literature. No. GDM, it's not everything about GDM that you must discuss in your, well, maybe even for GDM, well, primarily you may discuss most things, but it's not everything about HIV that you discuss, because HIV can cause so many other diseases. You won't start mentioning, start writing everything, HIV and diarrhea, HIV and TB. No. It should be core, key, you write, you can expand on the epidemiology of HIV. You can talk about the pathology of that virus itself. Then you now link it to GDM and move on from there. So yes, literature review is an extensive writing, but that doesn't mean because you want your book to be full, you start writing irrelevancies. The minute you do that, you lose your audience and the assessor, the reviewer will be irritated. At every point in time, please don't lose your audience. So when you're writing your literature review, still keep asking yourself, what is the nexus of this paragraph I'm putting to my research title or to my objective? If you coin what you are discussing to link up with that, if not, it is not worth being there. So those are the key practical things you should learn when you are writing literature review. Now, the other part of the thing you should talk about is when I tell people that, say, literature reviews are writing a textbook on that aspect of the work, which means you have read so wide, you have a good idea, broad view of that topic. What you need to do is you must break that your literature review into sections. And this comes by you reading wide. You've read so much about those linkages. You will now be able to say, okay, what are those thought patterns that should be under one title? What are those thought patterns that should be under another title? What are those thought patterns that should be under another title? Briefly, like there are 3 works here, I will show you that, just run it through quickly. So please note that for literature review, it works well if you break them into subtitles. And when you break into subtitles, it is good for you to get idea or inspiration on doing that. You can read previous work, you see how people are broken down. So, okay, so I too, I can do the same thing. I can do similar things. But what will make the 2 things will make the assessor to reject your work based on this literature review, or to say you should go and write your literature review again? 2 things. One is writing so much irrelevant things. All what you want to do is you want to fill the books, fill the pages. It will not impress anybody. 2 is that literature review means critical review of the literature. I will tell you what critical review of literature means. I will give you an example of how it flows. What it is. Critical review of the literature. And since it's critical review of the literature, when I just say, writing literature review means you want to write a textbook, that one doesn't mean you should just go ahead and write, you should just go ahead and just start writing. So when people write, say, okay, let me just write a textbook, most often than not, they will not critically review literature. They will not critically review literature. And the question is, what is critical review of the literature? What critical review of the literature means is that all the literature you want to use for a particular section of the literature review, you pick them. You can group them together anyway. You group them, you can group some together. Maybe you are talking of something that will talk about A, and some that will give you a particular result, some that will give you opposing results. What we expect from you when you're writing literature review is that you must show that you've read the result section of those literature. You see, when we're coming above, when you're writing your introduction, literature, justification, background, and all that. The key areas you need to look at in literature for you to write that one very well is the introduction of all those papers. But when you want to write literature review, the key areas that you must review, you must read very well, are the results section of those papers. Because it is expected for you to quote values. You quote values from the literature you've reviewed for us to know that you actually read those results, and to now tell us the implication of those results, which if you read the result and the discussion, they themselves, they will have been able to let you know the implication of their results. So literature review may go this way, to say that Tangetol, they say things like Tangetol in a retrospective study of HIV, of 150 HIV positive women in Tanzania, found that the prevalence of metabolic syndrome among pregnant women on drugs was 30%. Similarly, Eko Etor in Lagos found this among their cohort of participants. However, Aino Etor in Sokoto conducted a core study that showed among 30 women that showed that there was no difference, there was no increased prevalence of DM among people with HIV as compared to people with HIV. So you presented two research from, let us know where they come from, that said HIV will impact on DM. And you immediately, you have to now tell us that another one in Sokoto said there was no impact. So you now bring in your own word to say, well, after review these two, you can now say that, however, Sokoto study, the paper from Sokoto have smaller sample size, and therefore the conclusion from the study may not be reliable as compared to these other ones. That is what critical review on the literature. That is critical review on the literature. So you are now letting us see that you are still believing that it is still possible for HIV to be a cause, despite the fact that you have two reports that are saying opposite things. Part of what you want to share, want to show in literature review is to also now show those gaps in the literature. Each of the literature you are reviewing, you're now showing the gap live, showing the gap, critically showing the gap in the literature. And that gap that you are showing that will influence the type of study you want to do may be related to the study population, may be related to study design. Okay. For example, we know that retrospective study, there may be missing data if there is a retrospective study. So you now bring it out that these people found this, however, their study was a retrospective study. So because of that, and we know all the complications or the merit of retrospective study. So because of that, we want to conduct what? A prospective study, so that we avoid what? Missing values. On this, my topic that I was talking about, before they were using only nevirapine. So you write it there, state that, oh, so this so and so people, so and so study found this, but the study, what they used there was nevirapine, because that was what was used those days for PMTCT in pregnancy. So, but now the policy have changed to the use of so and so ART. So want to know the current state now. So that is critical review of the literature, bringing out important points. But I must say that it is not from beginning of your work to the end that you write like that in your literature review. There are occasions that you just state the obvious. Just state the obvious by saying that the prevalence of GDM was found to be between the range of 2 to 14% in Nigeria. By the time you say 2 to 14, range of 2 to 14% in Nigeria, you now reference like 6 papers. You reference 6 papers, which you have reviewed. So, but you have put all of them. You start saying, so and so talk, found period of this, saying this. So, you know, if they are not the ones you are supposed to critically review, you can just put gloss over and say the range of the prevalence of diabetes in Nigeria is between 2 to 7. I put all those references. So it's a mix of such writing and critical review. But critical review of the literature should be more. You should have more critical review of the literature than the other one in your work. So these are the good literature. We consider all literature and all aspects of the study, including methodological variations. This area, most people don't bother, but it is important because your study that you want to do, for example, if you want to compare open fixation to internal fixation, what you are supposed to do is you are supposed to pick that each of those surgical techniques and review literature on them. You review on open fixation and you review on internal fixation. Okay, so all those methodological things, most of those things should come up in the literature review. And this methodological issues too, for those of us that are into epidemiology, is also very important to us because there are 1,001 study designs that we could have used for our studies. So to justify the type we use, you have to describe all the various methodological issues in your literature review. And you now talk about their merit and demerits, and now come down on the one you used. But for clinical work, most of the time, it may not be an issue. So please, for you to be able to do what I've just said, you must have read extensively on the topic. Yeah, so as I've said, you make a list of the subtopics that you want to work on and you write them. Now, this is where people miss it. Yes, you can start from a broader topic and you now cone down, like this HIV and GDM we are talking about. You can talk generally, say, okay, the epidemiology of HIV, how it causes endocrinological problem. And you now cone down the impact of HIV on the pancreas. But on these other areas, because you want to fill the book, don't write so extensively on them. No, just write briefly and now come down and face HIV, pancreas, GDM. You still have enough to write, don't worry. And by the time you are writing 4 or 5 pages of literature review, you are fine. It's fine. Okay. So those are the points. So as I always say, I'm explaining, I'm making it interactive, but at your leisure, if you're about writing your own, pick each of these points and just develop them when you're writing to your specific area of need. And you'll have, before you know it, you'll have finished writing. I remember there was a mentee that they said they said you should go and rewrite the literature review. That I didn't critically review the literature. I just explained like this, that this is what critical review on literature means. And I gave my own work. He just read through it and said, okay, this is it. And he wrote the thing. So all what we need is this information to know what to do, and we'll do it well. Don't worry. And he did it so well, and they sent the book back, and within days, assessor accepted it. Okay? So look for good literature review, previous work, read through them, and from there, with these ideas of what I've said, you see, okay, this is a good one, and then from there you write your own. Okay? From there you write your own. Let me just, in the light of not just sharing this, let's just look at some literature review again. Sorry, we need more question. Can you see my screen? Hello?
Yes, we can see it.
Yes, sir.
Okay, fine. Okay. So you see this literature review. This talk about trends and of cervical cancer in South Africa. She started off literature review, pathology of cervical cancer. Potent, just okay. And when you are on pathology here, which is not the key, you just write then from there histological types. The reason for writing histological type is that there was trends on the histological type. For those of us that will be writing PhD, it's also good to put what we call conceptual framework. Okay. The risk factors, because you are dealing with risk factors. The study is about risk factors. Okay. Age and cervical cancer, genetics and cervical cancer, risk of, that. But as you are writing it, please always come up with the idea that if somebody asks me that, why am I including this? So just quickly put it in. Okay? Just quickly put it in. That's why I say we should break it into two. Because I know how it is like abstract. I just try my best to make it as practical as possible, not just theoretical. I've been there before, so I know what it is. So this was the one on HIV and glucose intolerance in pregnancy. See, literature review, burden of HIV, burden of HIV/AIDS. See here, there is no critical review here. It's just stating the obvious. So as I said, it's not every time you'll be writing Hello, sorry, please. So this part, they are the one I'm saying that there are some areas you write, you don't need to, don't need to stretch it. These are just the first part of there is a speaker that is on. Okay, so you see another section, pathology and clinical cause of HIV. I want to just show you an area that critically review literature for you, and I will read it. So you see what I'm talking about. All these two did, but I know there is an area that the critical review there, get it's very deep. Okay. Okay, fine. So you see this title here, go a bit long, but I will just keep on it. Endocrine and metabolic disturbances of HIV. There is still some, let me stick with that. I hope that will still be. So all the okay, so let's look at this. Pathophysiological risk of gestational diabetes mellitus in HIV positive pregnancy. Based on the body of knowledge at the time, Kara et al. Recommended that HIV patients should be screened for diabetes at diagnosis, at commencement of ART, 3 to 6 months after commencement of ART, and at subsequent regular intervals. Okay, so you write, you let people see all the information here. But in introduction, background, no, you don't have this liberty. You must summarize. Anybody that wants full details should go to your literature. Okay, so you see here, we're writing full. The guidelines by the International Diseases is that HIV-infected individuals on protease inhibitors should be screened for DM. If HIV patients are recommended to be screened for diabetes mellitus, either called their status or ART, then it may be reasonable. See, you are bringing your own voice now. Then it may be reasonable to do selective GDM screening for pregnant HIV positive women. However, this is not the current practice in our environment. Okay? I want to really show some places that have really. Okay. Anyway, I will get it out for you against. I will get it out against next week. So you see those. I know it's here, but just get it out. So I will get it out for you next week. So. Put yourself, yeah. So when they say you should, when you now want to review the please. Please mute yourself.
I've been muted, sir.
Thank you. So from here, what do we see here? The key thing here is that please, whenever you are reviewing literatures, attempt to make sure that at least 70% of the literature you reviewed are within 5 years. Okay? Google these days have helped us. Those days when we use we have to go to the library to use hard journal articles. It wasn't funny. But these days, with Google, when you just Google, you get so many journal articles that you can use online. Okay, that you can use. And so please, if you can limit to 5 years, fine, but don't go beyond 10 years. However, I must state that there are some journal articles that are even as old as 40 years that you still use, because maybe they are the foundational historical journal article on your research. So don't be rigid and say, because we don't want you to be penalized for using old journal articles, you will use it. Okay, so please, journal articles, like if we are dealing with insulin and DM, for example, we have to refer to where the history, who was the first person to discover insulin. It to be something very old. Okay, so that's the way journal literature review should go. So please, are there any question? Are there any question on literature review? We are fine. So
there's a hand raised.
We have a class. Okay, fine. So please, you have the floor, please.
Okay, thank you very much, sir, for the lecture. Please, I have some questions. Number one,
okay.
I want to ask, what's the difference between systematic review, analytical review, and the critical review? And when do we use each of them? That's number one. The second one is, which voice should we use during literature review, passive or active? Then the use of past tense or present tense in literature review. Then lastly, I want to ask, because some people do say that, okay, we should use literature that has high index number, or that those that have the highest number of citations. I don't know your take about this. Thank you, sir.
Sorry, what is your name?
Owolabi, sir.
I'm so happy. You are just like
Thank you, sir.
The other Owolabi, as I said, in the other training. Fine. I think I got some of them, but anyone I didn't get, please, you just recap. Very good. Thank you for systematic review. Yes, please.
Yeah, the other hands raised. So do you want to attend to one after the other, or all the questions all together?
Okay, fine. Let's pick all of them. Let's hope.
Okay.
I have some in the chat box now. Okay, let's pick some of them, because there may be intersection.
Okay, Khadija Hamad, I think you have the floor, please. Thank you.
Okay, good day, sir. Thank you very much for this enlightening session. My concern is, in the literature review, does one need to take each of the specific objectives and critically look at the literature that talked about those specific objectives one by one, or I don't know, is there a need for that, or do we just look at the main aim and then critically review the literature based on the general aim? Thank you, sir.
Thank you, madam, for the question. Yes, so since we say we want to take all of them together, so let me, any more before we start?
Those are the only two here for now.
Okay, fine. Okay, fine. So I will attend to them, then afterwards I will attend to those in the chat. So let me start with the last speaker about, so okay, please, if there is any of the questions that I didn't get or I didn't respond to, please, you can ask again. Then I will attend to it, please. Okay? I'll just try to jot them down. So for the objectives, using objective to say, okay, critically review and all that. The idea is that if you feel that if you go by objective, you will have been able to review all what you are discussing. Why not? But from my experience, it may not be adequate to just review the objectives. And then one time that objective, it may be nice to use objective is if your objectives are like step ladder. One is feeding to the other, one is feeding to the other. Like if you have objective that the first is to talk about social demographic characteristics, then that means you go to the literature review, talk about review literature on social demographic, then you go to association between A and B. If that is your second objective, then you go and literature review to talk about that association, then from there to a third objective and all that. So yes, you can do that, but looking at it generally, you may not cover everything you need to cover. So there is no hard and fast rule about it. If you feel that after you've done that, you've covered everything, after you've also checked other literature reviews or what they cover, if you feel you've covered everything, fine. But it may not be possible for you to get everything sorted. Thank you. So if I have not answered all your questions, please, after I finish now, you can just still ask, because as I said, the key thing with this work, what we are doing is interactive. We want everybody to go back home and be able to even disseminate further and say, okay, this is what I've been able to gain. I have some clarity. I can also organize similar workshops, similar training in my proposal. So for Dr. Olabi, the issue of systematic review is different from literature review. Systematic review is more structured than literature review. And that is why these days, in the olden days, your literature review, you can easily get it published. But these days, what we write as literature review now is what they call narrative review. And why do they call it narrative review? It's more of, it's not evidence-based. Okay, it's not evidence-based because sometimes it's what I review that I just write about is my opinion, things like that. But when you do a systematic review, you even conduct analysis. You even conduct statistical analysis based on what you do, and you have very strict regime that you will use to be able to pick, select your data, that's your journal articles and all that. It's very strict criteria that you use. And in fact, systematic review is up there when you talk of level of evidence, because you are collating all the various evidence and you are putting them together, you are analyzing statistically to come up with but when you talk of literature review, it's like a narrative review in which your voice is still everywhere there. It's not as structured. So lest I forget, these days, most of the journal, maybe please remind me, IPP, remind me so that I will include it in the next session, next week, so that we'll see how we can search for, because part of what some of the guidelines recommend now is almost similar to a systematic review. They want you to now show how you actually search for, the, somebody is using two sets, 2 sets at the same time. I now put one on, and unmute one. That is why we are getting this background. So please, if you are the person, just please stop it. Just let's mute everybody so that background noise can go. So part of what you expect to do is you should be able to know how to engage the search engines. Okay, how to engage the search engine so that you can get your what you need. I just hope if we don't finish next week, we may plan another time, not necessarily upper Saturday, another time for an interactive session in which we can take it that, okay, we finish theory, because there are some things that I want to drop. One of them is this use of search engine, how you can go to PubMed, what are the keywords you put, and how you can search materials from there. That's one. So IPP, please, you may just put down these my things I'm saying so that we can find a way. Then another one is how to use a reference manager. At least I can discuss Mendeley. I can discuss Mendeley, how we can use Mendeley, our reference manager. Because please, before you ever start off your research journey, you must have a reference manager on your desktop. Please, I must know to use it. So I would like to show us in a 30 minutes, 30, 40 minutes, we should be done with Mendeley. So, and I will suggest for now, just go online. Who is the person now? So just go online and download Mendeley desktop. Then we'll discuss how we use it. That's 2. Then the third one is we can also do interactive session on sample size calculation. You can get there are some sample size calculation that we can also download and then utilize. So those 3 things, they are interactive, that I want those skills, I want us to have them, apart from this regular thing we are doing, please. But we'll find a way around it. So that's how literature review should go. Show out your search engine, how you search for the literatures you use. Okay, but it is a way off from systematic review. Systematic review is more rigorous and require more skill, technical skills to do. Okay, that is for systematic review. Then you talk about use of those papers that have high citation. Well, that's just idiosyncratic to maybe the assessor or whatever. What people just suggest is that you should make sure that it is a journal article in reputable organizations, okay? Reputable journals. That's just what people prefer. Because the reason is because you may be, if you go and quote from journals that didn't undergo rigorous peer review, you may run the risk of relying on false evidence. Okay, so but whether it's well cited or not, it's not the issue. The issue is that the journal article should be published in averagely okay journal, not the extremely high journal articles, just averagely okay journal. Thank you for those questions, and I'm sure it's helping us as a team, everybody on the platform. Then you talk about tenses. For literature review, you are describing things in the past tense. You are describing articles that have been published, work that have been done before. So you'll be talking about past tense. It should be a past tense thing. But if it is you that is not talking, then of course it will be, I think it's past present tense that you now be using. You will be the one, so you'll be able to pick which one. Then you talk about passive and active voice. Well, it may not necessarily be related to literature review, but it's in your whole work. Let me just talk about it. In the issue of tenses will be much more relevant when you get to methodology. In your methodology section, you will be saying, it should be what? Future tense. I will do this, I will do that. Because you've not done it. I will do this, I will calculate this, I will do it. The only thing that, like sample size, of course, will be that I've calculated sample size. But all other things in your methodology, I will, past tense, future tense. But when you've conducted the work, that is what some people run into, and some assessors are always angry about it. They won't go back to start changing the I will back to I have. Okay, which will now be past tense. All right, so that's the key area where tenses come in the methodology. Then in the issue of active and passive voice, generally speaking, in scientific writing, in science or on the side of science or quantitative studies, we prefer you use active voice. Active, okay? But in the process of using active, if it is a journal article, because most of the time it will be only one person. We don't like you using pronoun I. Okay? I did this, I did that. But if it is we, yes, we means you are part of that team. So it is like you are being anonymous about what you are doing. But when I say I, people feel you are attributing so much to yourself. So because of that, we want you to avoid the use of I when you are writing manuscript and journal articles. Rather, you use we. But for exam, even in this last exam that I just gone past, there was a candidate that was picked up during defense that you kept saying we. Who are the we? Is it not your work? Before he now said that he was referring to himself and the supervisors. That of course the supervisors also contributed their knowledge and experiences and skill, and that most of what he was talking about when he was using we had to do with how they handled the data and all that. That at that point it wasn't only his thought, that he got input from the supervisors. You understand? So well, that ruled him out of the whole what. But generally, for dissertation, assessors prefer you use you. And in the process of using you, I will want you to, it will almost be like a passive thing you'll be using. Rather, you use the candidate will do this. The researcher, the principal researcher will do this. The researcher did this. The candidate did this. Instead of saying, I did this, I did that. Do you understand? I hope you are getting those words. And those words are very important when you write. Because when you write well like that, you'll be surprised. Some people's work will go to the college and they will say it takes 2 months to come back. Some will go and within 2-3 weeks it will come back. You know why? If an assessor have to be correcting grammar, correcting line by line, by the time you finish reading the introduction, you just drop it and wait for another 2-3 weeks that you will have time. But if the assessor is reading and is enjoying, I'm enjoying this work, I'm enjoying this guy. Yeah? Just few corrections and everything, we just be on his bed and finish the whole work and send back to you. The same thing with me. If I have to, and for me, it's not easy for me to just overlook. When I see corrections to make, I'll keep drawing, track changes, this. So if what you are doing is difficult for people to read, and that's why you see me stressing. Sometimes it's not the quantity that matters, it's the quality. That's why you see me stressing. Introduction, just maybe 2 pages, potent, straight to the point. And the guy read it, How they will say, will come back and say, your introduction is too short. Why can you write 2 pages? If you've touched everything you should touch, or your justification, why didn't you write 5 pages on just nobody will say that. Really, what you've written is potent and hitting, and you know exactly what to write. Okay, it's when you are writing inanities, all that you'll be making errors, grammatical blunder will come in, start correcting and all that. Okay, so that sort out that. So that's those are the questions I think I jotted down, but if I have not answered all, please, for those of you, because I really appreciated that 2 of you even made oral contributions, I will still handle. So please just hold on for me. Let me get to look at the chat box. Okay, I thought they usually come before literature review. That's objectives and yeah, for most of the guidelines, they come before literature review, but it's not all guidelines that will say it should come before literature, because some people believe that it is the culmination of everything, of the introduction or research question, problem statement, justification, and literature review that will make everything clear on the mind of your assessor to now say, wow, that I can now see where you are coming from to come up with this, your objective and the specific objective. So all that are supposed to be building block to open the floodgate to the objective, and then from there we can now take it on to hypothesis, research question, and then to methodology. But as I said, yes, there are some guidelines that we say, okay, state it before literature review. Thank you. So you must make sure the guideline is your friend. So whatever the guideline says, you go with it. But if there is no guideline, I will suggest you finish your literature review, you identify all the gaps and everything before you now go to your objective. If after that, your literature review, the next thing I will go for is the research question. And then from research question, I will now hit the aim, and from the aim to specific objectives, from specific objectives to the hypothesis, research hypothesis, or I can even go research hypothesis before the aim and objective, and from there to methodology. So that one follows well. Okay. Sorry, I want to check the charts. Okay, this is another word here. Justification should be in your own words. Any need for referencing or in-text citation in justification? I think I've seen this question before. There is no hard and fast rule that says justification cannot have reference. If you quoted somebody or something in order to build a case for your study, why not? You reference the person. But if everything you are saying is about you saying from your head and everything, fine, you will not reference anybody. But I wonder if you'll be able to write up to three paragraphs without building a case with some other studies. Hello, participant, please send me a private text WhatsApp message with your email. Okay, fine. That was settled. Good afternoon. Are we going to get the PowerPoint slides? That will be part of the closing remark. The organizers will tell us about that. Thank you very much for this session. Very insightful. Please, what if you are working on a study that has not been explored and you have few literature to review? How do you go about it? Yes, it does happen. Okay, it does happen, but you will still get some literature. And that will make you see that literature review is not just very tiny thing. You can still have a broader literature that will now come down. Let me give you an example. I just read a paper recently that was talking about reproductive access to reproductive health during COVID era. So such a paper is talking about reproductive health during COVID. And this is the first time we are seeing COVID now. So where will the literature come from? Okay, but an innovative way of handling that would be what? You first start with reproductive health, you start with COVID, you talk about reproductive health, talk about all the various issues of access to reproductive health that has occurred in the past. I can also now talk about how a pandemic such as COVID, like Ebola, like all these various viral infections in the past, have affected reproductive health, access to reproductive health. And then you can now link it to say, well, based on all those type of literature that have suggested those, and we see that COVID is also in the same light as those other pandemics, then that may be a problem now. And funny enough, that's the same way they wrote their methodology, their justification, their literature review and all that. Okay, and from there, they now ended up, their study reviewed that there was no problem with access to. So in their method, they now start discussing that. Why is it that during Ebola, there was problem with access, but during COVID, there was no problem with access? So they now start talking that maybe the health system have been able to evolve, to come up with new technology, to come up with new ideas, ways of being able to mitigate those pandemic. Thank you for the question. So as I said, questions always help us to improve on our presentations. How many pages is appropriate for literature review? Well, for me, you can check the guideline if they put pages to it. If you write a background of 2 pages, then a literature review of 5 pages should be adequate. 5 pages, max 6 pages should be adequate. And please, that is why, if that is what you want to write, is a good reason why you shouldn't write junk. You shouldn't write all sorts of things that are not directly related to that topic. Okay, most of the time when I review literature review for people, most of the main work I do is to remove so many things that are not necessary, or I summarize them. So that's why I know. Is there any limit to the number of journal one can make reference or cite? Here too, the more the merrier. But based on my interaction, I'm not an examiner. Let me put it ahead of time. I'm not an examiner, but I've interacted with many candidates so that they send their work, we discuss work on it, they send their work, and I now get feedback of the assessors, and we discuss it again. Okay, so from all that, I can have an idea of what the assessors want or prefer. So what I discover is that assessors generally too don't like so many references. They don't like it. So my take from, at least generally for most dissertations for the part 2 exams that have guided people, assessors don't frown at 70 to 80 references. But where it's getting beyond that, assessors frown. And the reason for that, they will write it, is that most of the time, some of those references you are repeating. Sometimes it's even, maybe some of them will be very old, Some of them, you didn't even read it. What happened was that because a paper referenced it, you should just reference it. That it may be difficult for you to tell anybody that you've read. And then sometimes some of those references, you have referenced a paper that is good. You are now adding some journals that are not really, that we can't trust. So why not remove those journals that we can't trust and leave so, but if there are compelling reasons based on your literature review or some other aspect of your compelling reasons why you should reference more than 80, please do, but you can aim at that. Yeah, I've also been at a conference in which a very senior examiner also stated that references, maybe if you say, okay, GDM is high in Nigeria. And based on that statement, we now quoted 20 references. That we just know that you didn't read those 20 to write that. So do we need 20 references to state that GDM is high in Nigeria? No. By the time such a statement, you've quoted 2-3 references. That is fine. Okay? And you reserve the rest for other places. So these are practical things that I'm enjoying with this our interaction. Okay? So thank you for that. But if I have not answered any of the questions lucidly, please, you can still repeat them and we'll sort them out. This another question says, very lucid and informative sessions, sir. Kudos and super well done to the organizers of this educative workshop. Okay. So, fine for that. Hello, participant, please send this. Thank you, sir. Thank you, sir. Quite insightful. Thank you so much, Chief. Very informative, sir. You want question? No? Those things, those feedback, they are fine. We like it. Thanks very much for the lecture, sir. Here is my, okay. Thank you so much. Okay. All right. So I think we've exhausted all the questions. So if there are other burning questions, please, may we take them so that we can now have the closing remarks by the organizers. So we'll continue from here next week. If I can even share my slides ahead of time, you go through and you can, although these slides are likely to be updated for next week. So I'll add more information for the other aspects that we've not covered. So, but I can share everything. You can go through and prepare your questions ahead of time. And I want it to be as interactive as possible. Okay, I want to be as interactive as possible so that even if you have questions, if anywhere you are on your own research, you can bring your topic, your issues, and we'll discuss them. Okay, I may not have answer to everything, but I have answer to most of them. So, is there any difference between hypothesis and research? There is. We'll get there. There are differences between the two of them. May God reward your efforts. Amen. Amen. I thank you. Okay, so any other question? Any other question? Thank you so much, sir. We are grateful. Thank you, sir. I'm grateful. So if there are no other questions, I may just say that setting the agenda next week we'll try to talk about methodology. I know, yes, research question, hypothesis, objectives, and then objectives, then the methodology from eligibility, blah, 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 sites, targets, population, down to limitation and all the rest. We'll talk about them throughout to the end. then I'm tempted to just move on to say, okay, if after your proposal, you have your results, how do you present your results? And then how do you structure your discussion? But the mandate given so far, mandate given to me is supposed to make me stop at methodology and implementation, but I'm tempted to, because the feedback is really interesting. The interest shown by the audience, having up to 100 participants, it's really something I'm happy about. So with such impact, we may just want to finish up everything. So we can disseminate, and in your microcosm, you too can always get on well with your research work. So in the absence of questions and comments from my side, from your side, I will hand over now to the organizer. IPP, over to you.
Thank you very much, sir, for this very enlightening session. I'm actually quite impressed that a lot of people find it useful. It just goes to show that there are a lot of questions in the area of research proposal writing that need to be answered. And I think sometimes some people just need someone who can break it down, because research proposal writing can be very abstract. And it's something that is compulsory for a senior registrar in residency training, or even anyone who is doing a master's at any point in time. Research proposal writing is important. And if we as residents understand the details that are required, it would make the process easier and even more interesting, so that more people will want to go into research. So those are some of the things that motivated us to organize this two-day workshop. And I want to appreciate the facilitator who has taken his time out of his very busy schedule to come and break these things down to us. Thank you very much, and I appreciate all the participants present. So and we hope that everything that has been shared will stimulate us all to go back and read more and come back with a lot more questions to broaden our understanding of these concepts. So thank you very much. Thank you, everyone. We'll be back here next week by 1 p.m. And
thank you very much.
You're welcome, sirs. By 1 p.m. And we would have to consider, well, the option of extending it will be under consideration, and we'll have to discuss with the facilitator to find out if it's something that is possible or not. But for now, we'll be working till next week, Saturday, and also understanding that the festivity period is here.
Yeah.
So we have to put all that into consideration too. But thank you to everyone here present. This session, this workshop will not be possible without the participant as well. So thank you. And I wish everyone a wonderful weekend and the rest of the week.
Thank you.
Slides.
Thank you very much. So in the absence of any comments, so I don't know if you have any other remarks to make.
Well, maybe I will. It will be camera. We'll discuss for that. Maybe. But so please, as I said, I will send these slides ahead, but I will update. I will update the other aspect, so that if there are if maybe any of these slides, if there are areas that are not covered, please you can send your, or maybe okay, I will discuss with the organizer if it's necessary to send ahead of time. But the key thing is what the situation in which if there are areas that we are envisaging that we will not cover, you can send in your ideas that you want this area, so that we can focus, because it's for you, for the audience. So we want to make sure that it's area that audience really need, that we focus our attention on. So with that, I will just say I should thank the audience and the organizers for inviting me for this program. Thank you.
Thank you, sir. So based on what the facilitator has said, if you have any specific areas that you think have not been covered or you would like to see covered, you can send me a message on that. It's possible that it's already part of the facilitator's outline, but you can still send me as well. So I'll get across to him.
Yeah.
Thank you once again to everyone. So 1 p.m. next week, we'll continue this. Thank you.
Yeah. Thank you.
Thank you. Thank you very much. Thank you very much.
Thank you.
Thank you very much, sir.
Thank you. Thank you.